Gender. So we have a pillar on gender, on women rights and gender justice, and so GRB used to actually be under the pillar that I work in, but then we moved to the gender, and there's been a lot of transition in that.
Yeah, Oxfam is what's happening. But I know someone. I know what's her name? Amina.
Amina.
She's in charge of the gender. I don't know if she's the global gender.
Also, there's so many Oxfams in Nairobi.
Ah.
Yeah, Nairobi. So you might have applied to one, because we have, you see, essentially our headquarters are based here.
Yes.
Or rather, we say.
You moved here.
Yeah. So you have like different, we call them confederations.
Oh.
So you have Oxfam GB, and then you have the Oxfam United. That's like from the Scandinavian side, and then you have Oxfam International.
Yeah.
That's like the West. And then you also have the regional program, ECA, and then you have the Pan-African Oxfam, and they're all in the same building. So if you apply
they have an entire building that's Oxfam.
No, okay, now we've moved. We used to have like 2 floors at the atrium. Now we have, it's just Oxfam. But then now we are, because of COVID and downsizing and everything, moved to the ACS Plaza, where we just have like 1 floor. But yeah, it's just, there's a lot of Oxfam entities in the same space. So you might apply for Oxfam and then you realize, Kumba, it's not
Oxfam ni Oxfam. Oxfam ni
Oxfam from externally.
It's also those are different procurement people, those are different women rights groups. Opaqueness, eh?
Opaque.
And your definition of opaque. Chelena should come for next one.
Yeah.
You have apparently been moved.
Did you listen my night? You even Ali.
Hello, Sharon. Can you hear me? Hello. Testing, testing. Hello. Testing. Oh.
Unless you talk.
One, two. Mic test. 1, 2, 3. Topic. One, two, one, two, one, two, one, two, one, two. One, two, one, two, one, two, one, two, one, two, one, two, one, two. One, two, one, two. One, two, make this. One, two, make this. One, two. Hey, Sharon, can you get us? Just type in the chat if you can get us.
did you learn yesterday? Yesterday I learned yeah. No, I don't think anyone else has said it. I think things like this, 90% of the work happens before, and then the work inside is like 10%. This wouldn't work if you were you would have been like you're so anxious to be prepared for anything
This
to
game.
what introduces you if have you noticed when people standing on this side? Huh? I prefer it this. Yeah, I prefer it because people feel yeah. They're flexible. Yeah. One of my like chill out shows, I genuinely like chill shows. Yeah. So like Never Have I Ever, which I do on Netflix. I don't think it does things when you just like watching this and doing like some issue. Yeah. Which I also do like shows. So even it's I try to watch like that's in the so yeah, this one I think this is a young so what can I say? So this is really good. Okay. I was like, we will be here until 7 every day. We just let go.
That's one thing. Tired. Then there's time.
To be honest, it will come in the UK. It's like we are not that bored at that time. English people are like they're much more stubborn. But if you're not English, you feel like we did take that. We never wrinkles, heart problems.
The heels was like
She was here, one was interviewed.
Small people.
These two are side by side.
Just come up like you can undo the data. Just do me look at the box. The what? I was like, when they were sticking it together. This isn't the one that says what's that. This is the one that says what's that. Oh, you want it on me? I was thinking. I think that would fit in the I think we'll move those two. It's like moving those two. So all together. Okay. In which case, can you start with this? Further along. You need help. wonder if just have you got this? Yeah.
Yes.
I think we may want to start.
Okay.
National Activity for someone traffic jam.
Okay.
Around the next 10 minutes.
We start.
We can do it. And just begin.
Okay. Let's do it.
Problem.
do the rest of the instruments and stuff. I know Ryan's physically because it's been in touch with Tia, who was rather than living around, so she can she's still 7. It's been a year.
Okay, good morning everyone. How are you all feeling today? Yeah. Thank you so much for being here. I know we're getting started later than normal. I think we're just going to get started and people who come can catch up as and when. But today we're going to have a very practical, technical, hands-on day. So if you need coffee, drink coffee. Like, we're going to do our best to keep everybody awake and focused. So the topics that we'll cover, these objectives, we've got GRB analysis tools. We're going to carry out a situational analysis. Actually, sorry, we've actually changed some of the schedule because you are much more advanced than we initially planned. So we've made the schedule, the agenda won't exactly match what we're doing today. but hopefully that will be more beneficial to you because you'll be looking at real budget documents and developing real life policy responses to them. We're going to cover the citizen participation in the budget process in Kenya. We're going to, instead of the state expenditure prioritization exercise, we're going to have a section on unpaid care and unpaid care, because it's come up a lot and it seems like it's central to a lot of your understanding of gender inequality, which is brilliant. We're going to look at gender relevant data, and then we're going to have a section on reading government budgets and how to do that, as well as an exercise around program performance budgeting. So that's what we're going to cover, but before we do that, we want to recap some of what we covered yesterday. So there's going to be a ball involved, maybe two. Initially we were going to plan for everybody to throw the ball to each other, but there's too much equipment and glass lying around, so you're going to have to throw the ball amongst yourselves on your tables. But you'll be presenting to everyone. So we're going to start at this table and then we'll go round. And I'd like to pass the ball to the person next to you or across your table and just recap one thing that you've learned yesterday, like one topic. So everybody stands up. Okay, we'll start here. Sophia, what did you learn yesterday? Yeah, we'll turn on the mics actually.
Good morning.
Morning.
Yesterday I learned that GRB is not a budget for women, but I've forgotten the other statement.
That's okay, those notes. Thank you, brilliant. So yeah, Susan wasn't here yesterday, but that's fine.
Yesterday I learned that in the budgeting process or planning process, CIDPs are based on calendar year, while the ADPs are based on the fiscal year.
Brilliant.
That's something I learned yesterday.
Excellent.
Yesterday I learned about the whole budgetary process, the steps from the formulation, approval, implementation, and the audit. And I also learned quite a lot about the supplementary budgets. We may want to think of vying for a seat.
Good morning. So from yesterday, this was not mainly on the presentation, but from the conversations. So some of the barriers to GRB in Kenya, and I think I got two: the differences in our gender roles and norms, and also, which was the other one? The social attitude in Kenya. I think that came out greatly, and it can influence the attitude.
guaranteed to pass over and over. What did I learn? That a gender response cannot act solitary. It must be multi-sectoral, multifaceted, so that it can be able to respond to all the needs. And gender strategies have to actually come from different faces. Yeah, that's what I learned.
Thank you. If we pass it to this table.
Good morning.
Good morning.
What I learned yesterday is that you should do gender responsive budgeting because most of these economic policies are made by men and they are made up of men. And also I also learned the budget making process in Kenya and the documents and the timelines and all that.
Good morning, everyone. So yesterday, especially something that Lucille and Hannah really emphasized on is that the voices of the voiceless have to be heard in the budget making process. And from our group discussion on the implementation, I came to learn that mostly for these supplementary budgets that are actually passed, there's no public participation. So I think that is something that we need to lobby for so that we can have public participation, especially for the supplementary budget. Sorry, thank you.
Good morning. Three things. The first is that a lot of women, especially in this room, do not need to consult when it comes to their finances. And men, most of the men, had to consult their wives or significant others. The second thing is that the annual development plan for Nairobi County has already been tabled, and the new governor will have to implement the plans of the former governor, which I found very interesting, considering you might be coming into office, with totally new manifesto. So that was interesting to note. Also, I think something that came out is the need for regional integration, especially when it comes to harmonizing certain policies and laws, especially when you're looking at illicit financial flows at the borders, especially in the activity that we did, where not only are we losing a lot of revenue due to illicit trade, but it also has a ripple effect in the service provision, because the government needs revenues to fund hospitals and pay doctors and so on and so forth. So it was interesting to make that connection.
Morning.
Good morning.
He didn't give me the ball.
Yes.
For me, what I learned is there's a need to not only look at the impact that the policies we are developing have at the macro level, but also to look at it at the micro level, to look at how it trickles down to the people on the ground, to the common mwananchi. I think it's just we tend to just look at the macro aspect and then totally forget about the micro. Yeah.
Good morning. Problem of coming last. People say the things you wanted to say. But yeah, I think for me what stood out, and I may repeat some of the things that have already been said, but ensuring that even these conversations that we are having get to be understood by people who are in touch with, or who receive those services. We had side conversations over lunch hour with a few people, and that was also learning. For instance, when it comes to the audit process, the ground people know which projects are being done, which are not complete, And so, therefore, even as we advocate at a national, sub-national level, there is need to connect this kind of advocacy with the ground voices that are actually receiving these services, and they'll be able to tell how effective these services are. So that to me really stood out and challenges me to not only stop here, but to ensure that these issues that we discuss here also understood by communities out there. Yeah.
Brilliant. We've had 2 people joining, so Purity and Calvin. We're just recapping one thing we learned yesterday. That's it. Mike. Good morning.
So I think for me what I picked yesterday was I got to learn on how to be more objective in terms of analyzing the daily engagements of the community and see the kind of policies that also affect them to make the work more better or reduce the number of time they're spending on that work. And I also got to learn the Nairobi County ADP draft is ready. So I think I want to echo what Andrew has shared. It's gonna be interesting to see if Governor Sakaja is going to implement that ADP or push for fast development of the CADP. So, as in those were my key takeaways for yesterday.
Brilliant, thank you. Calvin.
Good morning. First, apologies for coming late. And what I learned yesterday, one is the budget process, that it was really clear. And whatever Purity and Andrew were saying is what I wanted to know. It was not so clear for me. What is the interjection between the new regime and the past regime? For example, we can give the example of Nairobi county government. How is it going? How are they going to work on the ADP that is there now to align it with what they have as an agenda, especially the bottom-up agenda, that we all know. So what is the interlink? How is it going to work? Yeah, and I think the experts are going to tell us, and I think that is all. Thank you.
Brilliant. Thank you very much. Morning, Priscilla. We're just recapping. Huh? Oh, sorry, Petronilla. We're just recapping one thing we learned yesterday, but you've just come in, so you don't have to be put on the spot if you don't want. But yes. Okay, so that brings us to the end of the icebreaker. So hopefully everyone is recapped what we've learned yesterday and ready for a big day of practical exercises. So please be seated, get comfortable, and I'm going to hand you over to Lucille. Thank you.
Good morning. Good morning. Can you hear me? Well? Maurice? Morning. Good morning. They can't hear me. Morning. Better? Okay. Better? Maurice? Welcome to day 2 of GRB training. Today we shall be looking at GRB tools and how can we analyze budgets using the tools,
Then you shall be looking at citizen participation and also the issue of unpaid care work, and a bit on data and how we can read budgets. So I'd like to start. So yeah, we're doing GRB analysis tools. Then you shall have a practical on the same. Then you shall look at citizen participation in the budget process, then gender relevant data and reading government budgets, and then you shall also do program performance budgeting. Okay, so go back to the previous slide. Which GRB tools are you familiar with? Or which ones have you heard of? Yes, Darby.
I mentioned yesterday about the interactive modified
approach. Okay. Anyone else? Which tool have you interacted with, or which tool do you know of? Manjiko.
Today's Manjiko.
The Economists, any tool that you use to analyze the budget from a gender perspective. So it's only Darwin who knows the tools. Shall I assume so?
Yes.
Yes. Hiya. Francis? Francis must know.
I'll tell you later.
She will keep us in suspense. Asha? You've never analyzed?
I have.
Gender-wise, using a gender perspective?
Just applying the general knowledge.
Okay. Share more. Use the mic.
All right, let me use an example. Mostly I do the public audit process, but for instance, if I'm analyzing the CFSP, the County Fiscal Strategy paper, there are certain things I look at, the performance, the priorities, projections, and the sector ceilings. So for instance, if I'm looking at priorities with the specific to certain sectors, I will look at what has informed the government to arrive at that priority. How do I identify a priority in the budget process? So if I'm looking at for instance, it's a women empowerment program, then I'm just applying the overall budget knowledge of identifying what are some of the priority areas that the government has, looking at informed by the previous data that we have on the budget trends on analysis.
Okay. Thanks, Asha. So today I want us to look at the various tools which are there, which you can use to analyze a budget, and then you shall also do a practical. So among the tools that we have Diane Elson's tool, there's Wondersharp tool, there's the 5-step tool, then you have a costing tool by UN, but these are the three. And there are so many tools out there, so don't feel confined to use only these ones. And then you could also develop your own at the end of the day. Yeah. So Diane Elson's tool. So Diane Elson was commissioned by the Commonwealth Secretariat to develop GRB tools. These were developed on the basis of existing approaches on how to adapt to GRB. The tools focus more on analysis rather than development on the budget. So basically, it looks at, for example, within Diane Elson's tool, there are some tools which you can use during pre-budgeting, some during budgeting, and others post-budgeting. And then you don't need to use all these tools for every GRB initiative. Then these are not the only available tools. There are other tools which are out there. Can you see? Is it too small? Better? Okay. So Diane Elson's tool has 6 components, but there are some which say they have 7. So these are the components which are contained within Diane Elson's tool. So the first one, you have gender-aware policy appraisal, which helps us to analyze policies and programs funded through the budget from a gender perspective by asking, for example, in what ways are policies
and their resource allocations likely to reduce or increase gender inequalities. Then we have make it bigger, yeah. Then we have gender-aware beneficiary assessments of public service delivery and budget priorities. Thank you. These are designed to collect and analyze opinions of men and women on how far current forms of public service delivery meet their needs and how far current patterns of public expenditure accord with their priorities. Then we have sex disaggregated public expenditure, they are quite a mouthful, expenditure benefit incidence analysis, which aims at estimating the distribution of budget resources among males and females. Then we have sex disaggregated analysis of the impact of the budget on time use, which looks at the impact of government resource allocation on the amount and the way that time is spent in households and how it can be analyzed. Then you have gender-aware medium-term economic policy framework, which incorporates gender variables into models on which midterm public expenditure planning is based. Then you have sex disaggregated revenue incidence analysis that focuses on the different effects on women, men produced by kinds of revenue. Then finally, you have gender-aware budget statements which review the budget from a gender perspective. Next slide. So all this, number 1 to number 7, is part of Dan Elson's tool. So depending on what you want to do, for example, go to pre, kindly. Make it bigger. You can see. So for Dan Elson's tool, we have pre-budget tools. Just what I have read for you, there's a way you can break it down. So if you have, for example, the gender-aware policy appraisal, you can use this before budgeting. It's a pre-budget tool. So it shall be used at the preparation of the budget stage. And as I had said earlier, it helps us to analyze policies and programs which are funded through the budget from a gender perspective. So some of the questions which it seeks to address in terms of application of this tool, number 1, are the policies and programs based on a gender-aware situation analysis, and do they reflect women's and men's different needs and priorities? Basically, a situation analysis, you want to find out the different needs of men and women. For example, if we look at the agricultural sector, specifically maybe the flower cut industry, what is the situation of men and women, boys and girls in that sector? What is the intersectoral allocation of resources coherent with policy commitments? Are the resources allocated to men and women in the flower cut industry, does it match policy commitments? Is the intersectoral allocation of resources coherent with the different needs and priorities of women and men? Are the needs of men and women met, for example, within the flower cut industry? Are the programs and projects funded through budget likely to reduce or to increase gender inequalities? So maybe we can have a discussion around gender-aware policy appraisals with respect to the flower cut industry. What is the situation for men and women, boys and girls within that sector? If you're looking at the first question in terms of the policies and programs. Enlarge. Umenini sana. It's a bit cut. Better, yeah? Are the policies and programs within the flower cut industry based on a gender-aware situation analysis? What is the situation analysis in the flower cut industry in respect of men, women, boys, and girls? Yes, Josiah. You have a mic.
So I think to start off, probably for someone who has not read about that industry may not know much. But
okay.
From the little I've read, yeah, maybe we can turn it to more context specific. But yeah, from the little I have read, the situation of women, you will find women doing providing much of the labor in the flower cut business. The laborers, the tilling of the land, the harvesting. Then you will find the managerial roles, the managers of the flower farms, being mostly men. Same as the owners of the flower farms, you'll find that they're men, at least from what I have read now. women will be casual. It means they lack social protection, the health, insurance, pension scheme, and those other benefits that other workers on a permanent basis would benefit from. But you may find that on higher levels, the accountants, the managers would have those benefits, and they would probably be men. So in terms of also those insurance schemes, they'll be benefiting from that. When it comes to the gender responsiveness, perhaps women, the leaves, maybe maternity leaves and all those things, because you're casual, you may not be entitled to those things. So when perhaps someone gets pregnant, it means they'll be out of employment up until a point that they can perform the work without the issues that come around or the challenges that come about being pregnant or taking care of a baby. Yeah. So in a nutshell, and someone else can add. Thank you.
Maybe we might not all be very conversant with flower cut. What about coffee and tea? I believe the dynamics are almost the same. At least coffee and tea industry are aware of the issues in that sector. For example, when men get paid and they get their bonuses, the way they disappear from the home for like a month and then come back. So yeah, maybe we can discuss that. What is the situation within the coffee and tea sector in respect of gender? Yes, Francis.
Can I use a different example?
Yes, please. Sugarcane.
The sugarcane. The ideal situation is that the labor providers are women, but when it comes, then when the harvesting part of it, the sugarcane is men, purely men, then when it comes to the returns, it's a men affair. As you rightly say, we've seen situations where men disappear, then they come back when they are basak, poorer than they were earlier. So the situation here, what we state that the labor part of it is actually women, the weeding, the planting, the cooking. For instance, when the harvesters come, they do some cooking, they provide for the harvesters. Then harvesting is men, purely. So when giving consideration in terms of resource allocation, there is at the productive level, that's where need to be consideration need to be put a lot of emphasis, other than the harvesting, because harvesting is something like one day, because the number of people are coming. But when it comes to weeding, planting, and all that, is about several times. For a sugar plant to be harvested, it takes actually 18 months, and the weeding time is about 6 times within that period of time, or between 6 to 8. So the larger providers of labor here is women. So it's important to consider this when undertaking budgeting. The place of women in terms of labor provision is very key. Then on the other end, the role men play need also to be given a percentage when doing this segregation, because yes, there is some work they do, but now when it comes to expenditure, women have no say. It's my money, shamba ni yangu. So you didn't come with any piece of land from wherever you came from. So those are the narratives that we need to start addressing now in our local setups. That the percentage contribution of women in terms of labor and their time, including the children, when, for instance, they are on holiday, they are weeding these pieces of land or weeding the sugar cane. So the time they consume in that piece need also to be given a consideration, allocate a percentage, so that it should be, what do I say, consolidated in terms of finances, so that if it was to be hired labor, how much would we have been spending during the weedings until the time of harvesting, so that when we receive the payments, we know how much are we apportioning to each category of the laborers or the people who participated in the production part of it. So as policies are being made, time consumed should be given a consideration and given a percentage, that including the children that we are not paying. The assumption is we are paying your school fees, so you need to, you compensate the school fees I pay through providing that level. So it must be computed so that we actually really know how much is the contribution of each individual gender. Yeah.
Just a question. In terms of hired labor, do you pay, for example, if you hired a man to do the work that a woman did, do you pay them the same wages for the same work done?
In ideal situation is no. The ideal. Or the actual.
What is the actual? Yes.
The actual situation is no.
Yeah.
Because if I hire somebody, after the work I pay. But if it's my wife, I will bring meat that is sorted out. So this is the actual that happens in our local setups.
Okay.
So if I'm hiring a man, somebody else, or other laborers to weed my plant, they are paid immediately. So a one-day activity weeding is actually today is for 300 shillings. But you will never see a man pay the wife 300 shillings. Yeah.
Okay. Yes, Calvin. Then we'll come to you.
Yeah, just to agree with my friend here is that, of course, generally the ILO says that 75% of labor in agriculture sector is by women. And there's a study that we carried out, the kind of women receive as compared to men. Men are majorly given cash, and for women sometimes they're paid in kind. So you go farm, you go do the tilling, the way you say, and then you're given a 2 kg of maize. Yeah, so that is it. So there is some level ground in terms of payment between women and men. Yeah, thank you.
I think I'm running up as well here. But just to echo on what Calvin said, I think the same study, women work twice as much, but men are paid twice what they do. And at times, even like women have to sleep with the people who pay them just to get the money that they're supposed to get. But also in our context, I think people forget also in terms of like the unpaid care work that women also have to do, because I was reading a study that said that women go with their kids to like the tea plantation farms because they can't pay someone to take care of their kids, and there are no child care centers where they can leave their kids so they can go to work. And because they need that money, because most of the men take the money and get lost, you can find a woman with a child on her side or down or in front and the tea basket behind picking. So I think that's also another route that we should also think of it in. Yeah, thank you.
Thank you. Yes, Dami.
I think in terms of situational analysis generally in agriculture,
there's this move by, I think maybe the previous government, that the bigger we are and the bigger we go. So you notice even under Big Four, most of their allocations and policies were large-scale farmers. So that in terms of policies, their response also were targeting large-scale farmers, and seeing that in agriculture women are mostly small-scale farmers, then in my situation, the question you asked, my answer is no. Like our policies are not responding to the current situation of women, even in horticulture, as given example by Josiah, and also in sugarcane, and also by Calvin in, So in all of it, women are in small scale, but we see that our policies target the large scale farmers.
Yes, Wanjiko. Pass the mic.
So I just want to echo what is being said in the room. Like women do not own assets like land for the large part. And because we are also very cultural, once you get out of your father's house, you no longer belong there. But where you're going, you also don't quite belong there, because they're like, you came, you found us here. So you really, in fact, in areas where it's communal, even when your husband dies, the land reverts back to the community rather than to you as a wife with the children of this man. And so the community will be sitting down to adjudicate how that land will be divided and shared amongst. And you might find that you end up with the smallest bit because you had one son.
Or none at all.
Or none at all. In fact, if you had none at all, your only share is where you shall be buried. Which is very sad, because then that means you have no access to finances. And as Dami is correctly saying, the policies that have been set in place have actually targeted big organizations. The chairperson of the Kenya Association of Manufacturers has published a report congratulating the 7 governors that have now come into power, 7 female governors, but also saying that that is not enough. That's not gender equality. We are not yet there, because even at manufacturing level, manufacturers are largely men. It's male dominated, male financed, and so there's no gender justice in that sense. And so policies are not addressing or reaching the smaller scale, who largely tend to be women here in Kenya. I'm hoping that will change. There's a lot of push and a lot of initiatives, especially by like institutions like MasterCard, that are now pushing for Young Africa Works, ensuring that TVETs are able to capacitate women, encouraging women to get into science subjects like engineering and stuff like that. So I'm hoping that there will be change, and of course policy takes some time before you're able to see the results. But the gurudumu is just going slowly.
It's just standing and not moving.
Yeah, we are not yet there. We are not yet there.
For me, I think my concern is how can we access resources, specifically land. Even if my father left for me a piece of land somewhere where I come from, because of the cultural connotations, women are not allowed to own land. So as much as I might be planting my beans and my maize, at the end of the day, I might not be able to access the gains from this land. Yeah, because it's all, I do the labor, the fertilizer, kila kitu, lakini at the end of the day, the gains go to the man. So how can we access land? And you know, land is everything in Kenya. So without even this land, I can't go to the bank and access credit. Yes, Susan.
Okay, as basic as it sounds, I think behavioral change and attitude is something very core, because policies and programs can be put in place and implemented and all that, but you go to the village, and because, like for example, yeah, where I come from, you're not even allowed to plant a banana tree, because that shows that you own the land. So until such norms and cultures are completely uprooted, at times there's a very long way to go.
Yeah, we can talk and talk and talk, like in equal ground. Things are different. Yes, Francis, you want to say something?
What I want to say is, who are these drafters of these legislations or policies? When they are sitting down to start drafting these policies, for instance, the Land Act, what was the tail objective of this? And unless we start building capacities of the locals and the local opinion leaders to take this knowledge down to people who actually uphold culture, then we may not be able to address the issue for women to own land. For women who are owning land, they are working, educated, have salaries salaries. They can go to the bank, get process loans and have their own land. But culture is something that is deep-rooted to communities at different cultures, cultural beliefs. These are the areas that we need to start to dismantle the culture so that the issues, attitude change can start from there. For instance, women inheritance. When I die, my brothers, you either accept to be inherited or you go away. And more specifically, if you're not given birth to a boy child. So once the moment we start changing these attitudes, then that's where we need to start. We need to start from. So why I started by asking who are the drafters of these policies or legislations? Do they do a situational analysis to understand what's affecting women at the community levels? Because this is where the rubber meets the road. Yeah. And normally, legislators formulate these legislations with the assumption that people already know. And last time, I was having an engagement with the Chief Magistrate in Busia. And she was talking about land issues. And most of the cases they handle in the land courts is actually land inheritance, the administrative part of it, and anything that affects how to own land, especially for women. So my question to her was, when you are adjudicating in court, who is adjudicating at the local level, where these cases are emerging from? When you say that you are handling cases where a piece of land was bought by 6 people, when did we have public barristers to educate the locals? Do they understand succession plans? Do they understand the process of owning land? And unless we come out of these offices, go to the ground where land is, then we will not address these problems. Yeah. So the bottom line is we need to start from the village. Build capacities of the village elders, build capacities of the men, build capacities of women, so that when I die, my wife should be having rights to own and succeed my property. Whether I've left her a will or not, she's the bona fide owner or administrator of my assets. So there is, at no point should my brother come and say he was my brother. When I was investing with my wife, my brother was not there. Yeah. If anything, he was actually possibly fighting against my success. Yeah. So at this time, when I'm sleeping in that grave, he's now saying it's my brother's property. It's not. This is my wife's property and my children. So we need to start building capacity of even our wives. Yeah. And then, again, even for these women to understand what we own. There are so many men who have died without their women understanding what kind of property they owned. Then during that burial time, the people who own my property or who know where my cows are actually just listening to see if any mention will be said that so and so is owning 10 cows of Francis. If there is nobody who is saying such a statement, now that is your property, because nobody is actually stating anything about or mentioning about that property. So it's high time we call a spade a spade. Inform our children, inform our parents, inform our spouses that this is what we own. Otherwise, this culture will remain the way it is for years to come. Yeah.
I think just to echo what Francis has shared, looking at the policy makers and our cultural policies, the place of the social policy is very strong, because that is where all policies are developed from. So I call them the silent laws. That in my community where I come from, I'm a Terik from the Rift Valley. In the community that I'm coming from, in the event that my dad got another wife, Mama Mdogo, the small mama, or my stepmom, is not supposed to come to my mom's compound. My dad is supposed to buy her land and construct her home elsewhere. And in the event my dad passes on, the property that my dad owns will not be divided amongst the kids. It's between the two wives. So for us, in my culture, it is already set that you marry your second wife or the third wife, but as the third wife or the second wife is coming, please note that the property or anything that man had before you came, it belongs to the first wife. So it is also like an encouragement. You also need to ensure that you work hard and invest together with your husband, so that also your kids will get a portion of what you're going to have. And I think for us as the place we work from, Youth Alive Kenya, we have this project on unpaid care. And we spent an entire year to sensitize the community, because it wasn't easy. Because until the day that men will understand that unpaid care is work like any other work, that is when also these policies are going to change. And that is also these men will also see the need of them going to public participation and advocate for water accessibility and not security and not roads. Because now they have a deep understanding that by me mentioning that this water accessibility needs to be reliable, my wife will be having less time to fetch water. And I think that is also where we also infuse the discussion on rights. And we tell, because like in the places that that we work in, most of the women lines, calling lines, are registered under their husband's name. And we tell them, in the event there is an opportunity, and you don't see the need of you going to register your line with your ID, that is already a concern to me. So we try to also bring the local administrator. If we identify such a concern as small as registering your line with your husband's ID, it is already a red flag for us. And we call in the chief to come and sensitize those men on why it's important to allow the women to register their line. And we also target the polygamous family. That in our couple session, if this session for this month, it's about a polygamous family, you will come to a session with your 4 wives, or your 3 wives, or your 2 wives. And we're going to discuss on gender issues with all your wives, so that we want them, even as they're doing, as in you're already married 4 wives, and there's nothing you can do about it, is the kind of life you're living in happy with you? So we're also trying to influence their next generation, that even as you are olding, please encourage your sons, Calvin, Andrew. Please remember that when you're bringing in another wife, these are the challenges that I've gone through. And this is how I want you to treat your wife. So that we're bringing the place of unpaid care through our parents and also the younger generation. So I think until when we will realize the place of our social policies, that is when we'll also be able to influence the legal policy. And the place of agriculture. In Rift Valley, if you go to Wasingishu, Eldoret, at the cereals board, the cereals, the lorries, as in the lorries that are bringing in maize, it is just men. There's no woman there. So even in my place, it is men who are in this agricultural sector, not women. Because where there is money, that is where my brothers and my dads will always be.
Thank you. Thank you for those contributions. The next tool that I want us to go through is gender-aware medium economic frameworks. This seeks to incorporate gender variables into models on which medium-term public expenditure planning is based. So for example, are MTS based on macroeconomic models that are sex disaggregated? No. I've looked at the budgets and I've not seen any sex disaggregated data. For the economists and statisticians, is the data disaggregated? No.
Only at national level.
Only at national level.
But
County.
County specific data that is sex disaggregated is very difficult. Even at the national,
Census or which one?
Like no, maybe from the census.
Yeah.
If they are using like the KNBS data, it's there for national, but county specific. Even Nairobi county itself.
It's not disaggregated.
It's not disaggregated. Which data? Sorry.
All data.
But when you go for public participation, which is in the
But is your budget disaggregated?
Do you say how many men, how many women you intend to impact with a certain policy?
No. Even further in terms of, for example, for persons with disability, no.
We have that data. What may be in the budget itself, probably, but we take that in consideration when we are doing our sub-programs. Like supply and chain, those women who are going to benefit from those tenders, we have that data. We also have data in the transport, infrastructure. We've done walkways, and you find 60% of people walking in Nairobi are women, going, I think, in the market and doing that forever. Take time and they walk a lot. So we have that data, and that is what it drives us to having those projects, the walkways, also the writing. Women are working rates, selling their burgers, and we have those flag masks.
But it's not easy to get it.
Is it available like because that should actually be public?
It should be, yeah.
It should then enable Purity, Dami and myself to be able to look at that data and say that this budget is not responding to gender needs. Or in 5 years' time, I keep talking to Josiah about impact. If we're going to measure the impact that has been made, then how do we say that in 2022, 60% of women were working, but now because of the gender-sensitive policies and prioritization within the budget, in 2027, we have reduced that to 30%, for instance. How do we, because that information is not available to us on the outside of the system internally.
Okay, very soon you're going to have it, and this is the time we are compiling our county statistical abstract. Then very soon it will be in the portal.
Yeah, it would be good if we have sex disaggregated data. Yes, Asha?
I think here is that the data is available, but when it comes to like doing the
disaggregation,
yes, that's where the issue is. Because, for instance, one of the things I look at when I do the analysis of the budget document is what we call non-financial information. Non-financial information is, as the name suggests, it's not issues to do with figures and all that. For instance, if I'm looking at own source of revenue trends, I'm expecting that the county government will be able to give a narrative of their revenue targets against their actual collection in some sort of sentences, not exactly figures or a table. So now most of the from, I can say everyone says where they work from where I work from as an analyst, data is very key. Because what informs my analysis is data. Yeah. When I look at the trends of own source of revenue, I'm able to say whether the county is setting realistic targets or not. That is just for instance. So projects that we did with the international budget partnerships, and one of the things we're looking at data from the Kenya, the National Bureau of Statistics. So they have the data. Like they will tell us that in a certain village in Kwale, access to water is 10%. But they are not exactly telling us how many households or how many women walk very far to get access to that water. So I think that further analysis of that data is what is lacking. But the general data of how many women are in Nairobi or how many men are in Nairobi, that one is there. But then that further analysis of breaking down that data is what is missing.
So I think moving forward, yes, Josiah is laughing.
Yeah, it's the hands that are competing to to go out. Yeah, and it's a very interesting discussion. I agree. There's some aspect of data that is available. It's been processed by KNBS. One of the gaps I've seen, it does not find its way in like a budget document. If you look at the outputs, the outcomes that those projects have, maybe in the budget, in the program based budget, that is not there. It's evidently not there, and it's encouraging to hear that Nairobi will be developing the statistical booklet. I also know some other counties that have that. So I think the scenario would be that the data from that is also presented in the outputs and outcomes part of the budget when they're doing when they're allocating the funds. The other thing I wanted to mention, and sorry for taking you back a bit, it's on the preparation of the budget, the tool that we're discussing here. I think for the benefit of everyone, if you could explain more about agenda analysis, agenda audit, and agenda impact assessment, how would that look like? Lucille, if yeah, I will repeat. Yeah, I will repeat. Yeah. I'm saying the tool that we're discussing, if you could maybe using examples explain to us what is agenda analysis, what is agenda audit, and what is agenda impact assessment, and how those things look like, then it will help us to kind of visualize even as we move along. Yeah, okay. Thank you.
Probably when you do the practical session. But agenda analysis is you're doing a situation analysis, or you want to find, it's an in-depth analysis of the situation of men and women and their subcategories. So you want to understand the inequalities between the different genders. That's agenda analysis. But we shall do a practical. Yeah. Allow me to move on. The hands which are up. Yeah. Are you okay? Are you sure? Yeah.
Asha said something very interesting about the data being available, and I just wanted to add on to that, like an example. For instance, we normally look at it more on terms of expenditure, but we don't look at revenue. And I'll give you a very simple example. So a lot of women in the markets pay taxes to county assembly, to county governments. But do border people pay taxes? No. Yet there are so many, and that would be such an incredible source of revenue for counties, but they hardly pay taxes. And so you find like women are further disenfranchised because they contribute to this economy. You know, your example of yesterday, who contributes the most, who has the least say, who's benefiting the least. So the women will contribute, they will be in line legally in doing everything, but do they benefit sufficiently? No. And that's something, because we always look at the expenditure side and we forget that women are actually one of the biggest contributors to our budgets, both at national and county level, because we tend to try and be on the straight and narrow path. But all these big manufacturers, big farmers, big I don't know what, they will be having their tax auditors trying to help them evade every tax that they can, or pay as little as they can. Yet women, on the other hand, are paying as much as they should. Yeah.
Thanks, Wanjiko. Next slide, please. You've jumped some things. Go back. We've talked about this. Next. Next. Okay. So part of Dan Elson's tool, okay, among those 7 tools within Dan Elson's, there's some tools which you can use post-budget in terms of GRB, and among them we have sex disaggregated public expenditure benefits incidence analysis. And just as Wanjiko has told us, are women and men benefiting from expenditure for public services? For example, when you talked about when women are paying the taxes, you keep giving more and more, and yet your taxes are not working for you. The least you could expect is, for example, if the taxes could cater for daycare services, at least you see where your money is going. So that is one of the tools, sex disaggregated public expenditure benefit. Then we have gender disaggregated beneficiary assessments. Do these public services address women and men's different needs and priorities? Yes or no? I don't think so.
They don't.
They don't. So that's another tool you can use in order to, if you want to look at public services, do they address the different needs of men? And I'm sure even probably there are some needs for men which are not addressed if you look at the budget.
That's an example.
I'm thinking about issues of maybe health.
A very short one is health issues.
Yeah.
When I was having a training with the budget officers from departments in Busia, what I learned, or what was coming out very clearly, was that in the women washrooms, there was toilet tissue paper. But in the men's washroom, there was none. And
You only have a urinal, you don't have the ones for sitting, or they're there, but no tissue. In the men's toilets, what do you have? The urinal and the other one?
Yes.
But no tissue.
No tissue. And in fact, the men who were there, these are budget officers at the department, they were saying we were using masks.
Right.
And they're the budget officers.
They are budget officers.
Surely.
So what we are saying is that so the considerations of men and women, even in these public offices, are not the same. As much as there is need to give a consideration on their specific needs to address those issues. And I've also gone to some of these public utilities like the toilets. You will find in our women washroom there's running water or hand washing water for hand washing. Rarely do you find running water in the men's toilets or latrines. So is it by nature? Is it by the demand?
I don't know.
You go to Busia.
So was it address the issue of toilet paper?
So For me, I was a facilitator. I was training them. So if they went and addressed it, is for their own good. But those are issues that are actually emerging that they are real. And I've said one time if you go to Busia, or when you come to Busia,
that's interesting.
Just go to the office of the governor's offices. You'll be shocked that there is a public office with such disparities.
Tissue.
And yet it's budgeted, you find
then why don't they put just the toilet paper in the toilet?
I think somebody is educated in procurement.
It's very interesting. For me, I was thinking about in terms of health. Women get to spend so much time in hospitals, maybe because of their children. They need to take them for clinics. But when you look at men, they don't go to hospital as much. So even in terms of issues of screening for cancer, we don't spend as much time in creating awareness among men as we do with women. So it's just another issue, according to me, which needs to be looked at in terms of the toilet paper and matters health for men. Yeah.
We go to health facilities
when you're sick, when uko mahututi, not
yes.
When you're taken.
Mahututi, really, really bad. Yeah. Allow me to continue since there are no other contributions. Sex disaggregated analysis of the impact of budget on time use. We talked about time use. We talked about time use, that we need to quantify the time that we use on whatever that we're doing. For example, do expenditure and revenue patterns are impact on women and men's time use? Yes, we do. The amount of time that women spend, for example, on farms needs to be quantified somehow. I don't know, maybe for the economists they can come up with some sort of formula how we can cater for unpaid care work either on farms or taking care of children. I know it's a tall order, but it's a conversation that we need to start talking about. How do we compensate for reproductive work and for labor? Even if my husband is the one who owns the farm, I need to be compensated for that time that I've spent on that farm. Sex disaggregated revenue analysis. Women and men affected differently by the kind of revenues raised by government, for example, such as direct income, corporate tax, or indirect taxes. Yes, definitely. We are affected differently. Like right now, when the price of unga has gone up, and women are the ones who buy food, what alternatives do we have? Yeah? So we are affected. Or even the price of oil. In fact, everything has just gone up. It's like 3 leaves now. And that can't feed a family.
So you have to spend more.
You spend more to get less.
Yes.
Yeah. Yes, sorry.
Let's say, for example,
you can give this in your personal opinion, because I don't think there's like a textbook answer.
Okay.
When these policies are there, do they have to explicitly state? I'm asking this because I think like a month ago, the National Treasury was asking for comments on the draft national tax policy. And analyzing it now from a gender perspective, there were no, like explicit statements. And that took me back to looking at maybe countries that rank high in gender equality. And when you look at their policies as well, they don't have like explicit. So for example, the issue on sex disaggregated revenue, there are sections where the policy recommends that there should be, what is it called, like periodical assessment of the impact of the revenue being collected on economic performance. So our recommendation there was also on social, welfare, and go that further. So do they need to explicitly state that it will be sex disaggregated revenue incidence analysis, or even when it's that blanketed, is there still room, even when it's just general revenue incidence analysis, is there a room still within that to push for that sex disaggregation?
I think we should be explicit. Otherwise, we'll be having gender neutral and gender blind policies which do not address the needs of men and women. I think personally, it should be explicit. Otherwise, you just say, oh, sikuna policy, but you see the policy is not addressing the different needs Acha sasa men and women, not about persons with disability. No one talks about them, you know. So I think so.
In Uganda, the equivalent of GEC there has to give a certificate for any budget or any policy before it passes, before the president signs it, to ensure that every policy is gender sensitive, because gender blinded and gender neutral actually disenfranchises the genders, because we just say that there's a policy, but it doesn't use evidence or data to actually ensure that proper allocations are done. So in Uganda, and I think that's a best practice that we could actually go with. And I don't know why it hasn't happened, because GEC in Uganda was actually a stolen idea from Kenya. So it should be something that we look at, like our organizations, our gender organizations, those who are duty bearers. Do they certify? Do they sit through the policies? Are they in that room? Are they on those tables? Martha Karua always says, if you're not on the table, you're in the menu. So are we here, as Lucille and Hannah and Ebian are saying, we have a lot of wealth in this room. Are we on those tables to say, but this doesn't address gender? Or how do we know that this is going to meet or fit into that impact that we're hoping to see, when we don't have data that supports it, when we don't have evidence that supports it? So somehow, somewhere, we need to find the relevance of the gender institutions and the gender duty bearers. Yesterday on our table there, before I left, we were discussing about how, like, gender as a department at county level is mashed up with education, youth, culture, social affairs. I don't know, it's clear that it's not a priority at all.
Yeah.
So how do we then make it become a priority? By requiring that anything that passes is gender sensitive. Yeah.
Basically, just gender mainstreaming across the board, from your policies to your programs. And it's not just looking at women, looking at men. If, for example, we cannot put tissue paper in men's toilets, something so simple, it's because it's not gender mainstreamed. So from your policies and programs across the board, you need to gender mainstream everything. Otherwise, you might find, fine, women are going ahead, but you've left the men behind. So we need to find a balancing ground that the men are not behind and the women are not behind. We're all at par, yeah, in our policies and in our programs. That's the only way, and that's why we need to be explicit. Otherwise, the policies are there, but they're not addressing anyone's needs. They're just blind. Is equal to, or they're neutral. Yeah. Next slide, please. So this is the second tool. We just finished Dan Elson's. This one is by Rhonda Sharp, a South Australian. By a South Australian. So the South Australian women's budget in the 1980s used a 3-category format developed by economist Rhonda Sharp, who had assisted governments in their efforts. So the 3-category approach was designed to assist government officials with analysis of the budget as the basis for presentation in its annual budget statement. It was not intended to be the basis of formulation of budgets. Yeah. So you can look at the tool. So it's divided into 3 categories, and the categories are, you can see even though it's colored. Okay. So the first category looks at gender-specific expenditures, and these are allocations to programs that are specifically targeted to groups of women, men, boys, and girls. For example, issues of GBV, or maybe programs on prostate cancer or sanitary towels. That is a gender-specific expenditure. Category 2, you're looking at expenditures that promote gender equity within the public sector or public service. These are allocations to equal employment opportunities, such as programs that promote equal representation of women in management, decision-making across all occupational sectors, equitable pay, and conditions of service. Maybe, for example, issues of affirmative action, trying to get more women into public service in terms of increasing their numbers. We've gone fast. So these are expenditures, or maybe training women to become managers in the public sector. So that is expenditures that promote gender equity within the public service. Or maybe daycare services in the county markets. That's another expenditure that promotes gender equity. The third category, under SHARP's tool, general or mainstream expenditures. These are allocations that are not covered in the first two categories. So the analysis focuses on the differential impact of the sectoral allocations on women and men, boys and girls. Although it is challenging due to lack of disaggregated data, it's not only in Kenya, it's across everywhere. I don't know, Hannah and Ebian, do you have disaggregated data in the UK? Is it easy to get disaggregated data?
It really depends on how disaggregated you want the data. So we're quite lucky, we have an Office of National Statistics that collects a lot of information through payroll and tax, the tax office, and this is disaggregated by gender. But the smaller you want to go, so if you want to disaggregate by gender and race, for example, gender and ethnicity, or looking at a more local level, the less available data you have. But if you're just looking at generally gender disaggregated data in terms of income, we collect that information. Time use, we do a time use survey, and a lot of information can be collected from the tax office because they're taxing everyone through payroll, and that is gender disaggregated. Any data that isn't gender disaggregated, you can request it, and if there's a large enough public good, they will publish this data after it's been requested without being asked. So in some cases yes, in some cases no, but we always want more to be able to carry out more accurate research.
I don't know if tax people will be able to share data. They're very opaque. I don't think so. I don't think they would. Even in terms of salaries, I don't think people are that open. You might find, for example, maybe Francis and I are doing the same work at the same company, same level, but he might be earning more, but I wouldn't know. So it's hard. Very opaque. Very opaque.
In 2015, we just wanted to find the human resource establishment in Busia. Then we also wanted to know in terms of sex segregation. It was a tall order. We were moved from department to department.
Writing letters.
Writing letters, going to the county secretary, it was not that easy. And at the end of the day, access to this information is very, very difficult, very, very opaque, as now that's the term. So when we were trying to find out the establishment of employees at the county level, we wanted to find out how many youth and adults are employed in all sectors. Then we were also trying to understand the segregation in terms of sex, male and female, and then the persons with disability. We were not able to access this data. So when it comes to payroll issues, employment opportunities, segregated data is not something easy to find out. The same with the county assembly. And Busia County was one of the notable counties where they overemployed by 100 employees when they needed 52. So they ended up employing 152.
Ghost workers, the extra.
Yes, the extra ones, and I think it's still an audit issue that needs to, because they were not able to send them away when it became an audit issue. So these guys are still there, earning money for doing nothing. So as Simbarat was stating the other time, he found so many ghost workers, drivers who could not even drive. So the bottom line is that it's not easy to get data when it comes to employment and payroll.
I wanted to add when we talk about expenditure, I've noticed most of the analyses actually focus, in terms of that general expenditure. When you mention the data on payroll, it's indeed a challenge, because how then do you quantify how gender responsive the recurrent expenditure is? I've noticed like most of the studies focus on development expenditure, because then that one they have those targets and they have those key performance indicators that show the same. But this is just to reiterate what you say, there is a challenge in data, because yes, there is. And you notice that even when we say maybe Kenya's budget, I saw Josiah, I think CCGD tried to quantify how much of our budget is actually gender sensitive, and they had around, I think, 11% for 2021, 2022. But I am sure that number will be higher, because we tend to neglect that recurrent aspect, because then we don't have data to show. Ministry of Health has employed maybe this number of female employees, and this amount of their budget goes to paying a woman, and this amount goes to paying a man. So yes, and I think data is still like a big challenge to GRB in Kenya.
That figure could actually be higher. If you read an article by Publish What You Found in terms of gender financing in Kenya, you can only track, for example, the funds that donors have given towards gender projects. Now, these other ministries, education, agriculture, probably there are projects that do gender work or whatever, but we can't know because we don't have disaggregated data. So it could be actually high, is it that we can't quantify it. Yeah.
And there is also that confusion
of the gender and women, or which one?
When you
We look at the gender specific expenditure, it is always like changed for expenditures that promote gender equity. Like, so for example, if you talk to someone from State Department for Gender or Ministry of Health, they will actually tell you, yes, our budget is gender responsive. But now when you come down and ask them which parts, which programs, then they tell you we have the Linda Mama, but you see that's a gender specific expenditure, but that doesn't mean the whole of the Ministry of Health expenditure promotes gender equity. Yeah.
So that's another confusion. So people think that by funding projects which cater to women only, then they're being gender responsive. But it should be able to cater to the different needs of men and women. So that's another weakness with this tool. It talks about gender, but the gender is referring to women only. Yeah. So that is about SHARP. So it has those three categories. I need to rush because we need to go for break. 5 minutes, please. Then when we come back, we do a practical.
break.
We break now.
We have 20 minutes.
Okay. So we can go for break. Then when we come back, we'll do a practical.
There's tea and coffee and snacks outside.
what they were saying. Yeah.
Because the citizenship is a discussion, reading budget requires consultation. It's important to consult. I think the discussion and it's like that they have a day so they can talk. They keep bringing it up when they talk about like mine, you want to plate it? Yeah, I like Are you still going to? No, I'm dry. No. I'm gonna just wash it and leave it. Will it be like hers? You've seen it, I think. It's not as tight as hers, but it's still curly. That'd be very surprising. Yeah. Hers is so full. There's some people who are very flat.
I'm saying heal. So what is the difference between me and Moses? Don't answer because I know you know. Oh. So this is you playing it safe. Fast.
they should also go with us for those demands and highlights. And it's subconscious in a sense that they say. Because it actually sends you a message that you made a thing that's needed, actually a challenge is needed. That's when you needed the most. Like, that's not because new
else? Hello? No. Is it? No. Testing. Okay. Hi. Are we feeling rejuvenated? Do we have enough sugars to continue? Awesome. So I'd like to take us through one more tool, and then we shall have a practical. And then, yeah, we shall see how the day unfolds. So this is the 5-step approach. I think Dalmi said she's on, there's something talking.
Is that the
5-step approach. You know this one?
Yeah, but I didn't know it.
You didn't know it's called a 5-step approach?
Yeah, I'm refuses it and all.
Ah. Why is it? Is it me?
Yeah, we're good.
So I think at least for this one, most of us are at least conversant with it. Eric, the previous slide, please. So I'll just run through quickly so that you can have more time for the practical. So the 5-step approach was developed in South Africa, and so far the countries that have used it are Philippines, Tanzania, and Uganda. At least this one is more homegrown. It's by one of our own from SA. It's useful for inside government initiatives and countries that are implementing either program or performance budgeting. I think in Kenya we're implementing program budgeting. In practice, the main weakness is the use of this approach has been limited ability to move beyond the second step because we don't have data. Yeah, so it is a very easy approach. However, you tend to given sector, and then the second step is policy analysis. Whether the policy or program shows the intent of government or what it aims to do in terms of addressing the concerns. And when you're analyzing, you want to look at the analysis should highlight if the policy objectives are adequate and in line with what has been identified in terms of situation analysis. I think for the first two, we had already discussed it under Diane Elson's tool. Then you look at the budget analysis. Even the budget analysis, we talked about it under Diane Elson. Allocation of resources are critical for action and appropriate utilization of resources. And what you look at, the analysis should verify if the policy commitments or intents are backed by resources. Even that one you talked about. So the first 3 steps, you do a situation analysis, then you do a policy analysis, then you look at the budget. Number 4, output analysis. This looks at the physical targets to be achieved over a period of time. And what is required is you verify if the targets were achieved as per the plan, especially serving the intended beneficiaries. So you need data in order for you to check if you've met your targets for this one. The last one, outcome analysis, assessment of the improvement in the targeted indicators, impact. You can't measure impact if you don't have numbers. So even that one will require numbers. So analysis should be pre and post implementation of a set time frame to be able to verify multi-year results. So even in this one, you shall need to collect some data. So that's it with a 5-step approach. You do a situation analysis, policy analysis, budget analysis, output, and then outcome. It's that simple. The only issue is data. Yeah. So for our practical, next slide. Now this is an example of the 5-step approach that is applied to the water sector. So the situation analysis, you have the questions, policy analysis. I can share this if any of you want so that it can guide you. Okay. So for our practical, we shall be analyzing sector reports of the Nairobi County Budget Policy Statement. No. The program budget for 2021. And we shall be using the Rhonda Sharp's tool, the 3-category approach. So in order to assess whether or not gender was mainstreamed in the budget policy statement, we shall follow the approach by Sharp and Uyo and Hewitt, 2003, where expenditures to promote gender equity and equality are classified in 3 categories. So the first category shall be looking at is gender-specific expenditures are allocations to programs that are specifically targeted to issues affecting the different genders, men, women, boys, and girls. That's the first category. Category number 2, equal employment opportunities expenditures, whether monies within the Nairobi County have been allocated in terms of that go towards employment opportunities, whether for men or for women. Such programs that promote equal representation of either women in management or in terms of capacity building and decision making across all sectors, even in terms of maternity leave, creche facilities. That's the second category. And then the third one, general or mainstream budget expenditures of government departments, which makes goods or services available to the whole community. This analysis will focus on the differential impact of sectoral allocations on men, women, boys, and girls. For example, in terms of who are the beneficiaries of education services, health services, etc., etc. So, using these broad categories, we shall be analyzing the Nairobi County performance budgeting using the 3-category approach. I just don't know how I'm going to. I think I'll have 3 groups. How many are we? 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 10, 14, 15, 16, 17, 18. 6 people per group.
1, 2, 3, 4. 1.
No. I need 3 groups. Yeah. So 1, 2, 3, 1, 2, 3, 1, 2, 3.
Yeah. Oh, you need 6 groups.
3 groups because there are 3. We're using the Rhonda Sharp tool, which has 3.
So we shall be 6 in a group.
Yeah, that's what I said. We shall be 6 in a group.
So we can't have to 1, 2, 3.
1, 2, 3. 1, 2, 3. Umeshika. Ah, yeah. 1, 2, 3, 1.
1, 2, 3, 1,
3, 1. Itatoka sawa. 1 pamoja, 2s, 3s. We get into our groups. Huh? You are right. And if you do 1 to 3 or 1 to 6.
1 to 3.
1 to 3 Sibo.
Because we want 3 groups.
Yes, 1, 2, 3. So that there are 6. Wanjiko?
Yes. They were trying to bring me back.
Okay, time is not on our side. We can have
them.
Group 2.
Group 1.
Oh, you don't want to change those groups? Okay, sawa. Change of plans. Yeah. This is 5. So you need 1 here, 2 there. Huh? We changed. This is not how they sat yesterday. Yeah. Mnataka nani? Ai, Asha. Hey. Wanjiko naenda wapi? So Wanjiko and Anita will join. We need 1 more person there.
Why?
Why not?
I have reasons. Best known to yourself.
You can't put
So Asha and Darmi.
And Darmi together.
Kwa nini?
We have a
Aya, then Francis and Asha to exchange. Francis kuja. Wamekataa. Acha tukiti, acha kiti. Wanakuwa tu opei, kachana nao. Thank you, Francis. Aya, Wanjiko? Or there? Wanjiko, you're needed there. At least. Aya, we download the PDB. Unajua mpaka niseme pole pole, si ikiwe PPP. 2021 Petronila, I think that's the latest. I'm in 2020. Yeah, the budget. I think it's 2021 program budgets for last year, 2021. There's one that's already downloaded. Program-based itemized budget 2020-2021. It has some green outline and then the heading is in blue. You should open it from your laptop. It's quite a bulky document. It's about 160 pages. Program-based itemized budget, Nairobi County. 2020-2021. And I'm seeing akina Darmi already. Na mimi kila mtu ako na laptop. Yes. Masource. Hey. But you haven't opened. None has opened. After Josiah bado. Program-based budget, Nairobi County 2020-2021. Mmepata? No.
Oh yeah, like here.
You've seen it? See, hapo kwenye nini? 2020-2021. So kwa financial year sasa. Hebu try this. Try that. 160. Yeah. Asha? Download. Can you put it there? Seriously? Mmepata? Okay, they're being so serious. Uko nayo? 2020-2021. Imefunguka? Hii iko na blue na green. Si hata lazima nyi wote mfungue. And hiyo. So now for the instructions, I'm hoping that you've been able to access. So using the, hello?
Yes. What is the question?
Using the Rhonda Sharps tool, I think we can analyze one sector. We don't need to do agriculture, health, nini. So then, but different, for example, if we do like, I don't think we have agriculture. We can do health. We can do health. Look at the health sector. And then using Rhonda Sharps tool, you analyze health sector. So you guys shall use the first part. Maurice, take me back to the previous slide, please. Yeah, Panza. Gender-specific expenditures in the health sector. So you're looking at programs which specifically address issues of men, women, boys, and girls within the health sector. Mko poa? Sawa sawa. Masos. We shall look at look at number 2, Eric. Equal employment opportunity expenditures for civil servants, such as programs that promote equal representation of women in management and decision making within the health sector. And then this one, download. Download. And you shall look at the third one, general or mainstream budget expenditures of government departments which make goods or services available to the whole community. For example, the analysis should focus on the impact of the sectoral allocations on men and women. Bado kwa mambo za health. Okay. Sawa. I give you, it's now 11:45. 12:20. 12:20. 12:05. Mpaka 12:05. It's 11:45 now. Those are 20 minutes. And then you shall have 15 minutes for plenary. Kindly use the flip charts. Nimeomba. You can use the flip charts and we've made it close to you. So we shall talk at 12:05. (2020, 2021). 2020, 2021. Uko umefungua gani? 2021, 2022. No. 2020, 2021. There you go. That's one. It was going to get very good. I've been talking for such a long time. It's okay, I'll just sit here. We wait for them. Do you want to take lead on the unpaid care work?
I'll explain the instructions.
Yeah, okay.
I feel like they'll do peacefully amongst themselves.
They're very bright. I have two. You like staying in these shoes. What do you call these shoes? Do they have any name?
I think it's like a clog.
We call it.
I can hear you. What would you call the shoe? Yeah, clogs. You like this? Yeah, they look very comfortable. We have, okay, not exactly this is sweat, yeah. Ours are plastic. Oh, yeah. Oh, I've got those. We call them flip-flops. Oh, little Crocs. It's the brand, I think, that had the original shoe. I got maybe 2 imports.
Yeah, right. Your lips.
After lunch is the first session.
Page 25. It's great.
It's really nice.
Yeah, we should done. We should have like the guy where the agendas. We should publish this. Oh, like this.
Like on the day. I like how you're learning on the. But this one I'm gonna change it. Actually, it's gonna be. It's like you say a number and then another person says it. If somebody else will say the same time, we have to start again. So at the same one, someone should say two, but there's no. We don't know. No order. So this reading is just this data would be
No, we'll just still do the same budget. That's what they're using right now. The profit margin is 16. Actually, this exercise is going to be the best one. But your son has talked about gender analysis. Those are all those tools that you don't just talk about gender analysis. It's like same as GRP, it's a tool that you apply somewhere.
And today, after my email me the resources for yesterday and today, I'll start drafting the email, which I'll have to because they saw
that's what you that you talked about.
Yesterday was we had the IP.
Oh, so it's somewhere.
Do you still have the photo? What you took from the documents, not all members are not supposed to attach.
So there's somewhere where
Then today it's just GRP tools, then you can add gender analysis, gender impact, health, gender audit, analyze
lump sum.
I know the development plan. And it comes from the CIDP, the County Executive.
But this is from the drive. This is day one. But this is all on the data drive.
Yeah.
But the tools, where are they?
I have slides, not unless now I share.
Is the slides
The slides I want to share.
We're going to share the slides.
Other than the slides, writing of analysis, gender audits. All these are tools.
We have the document.
Item number. Number.
We've made some adjustments. We've made some changes.
For tomorrow.
Those men.
So I really wanted to
They deliver parcels.
yeah, so they're only working together. So I don't know what this is. stakeholder.
Move stakeholder analysis, and then I'm just going to present the WPG advocacy strategy and the learnings for network marketing. That will be more like a presentation than I then after the meeting, after the session,
But you're also talking tomorrow on knowledge sharing and learning. There's another session on this.
That was the job in times.
That's one.
I decided to replace that with a network building practical exercise. So I'm going to give a few pointers on the principles and beliefs, and then I want to make sure that each table is on as someone working in a completely different space. And then I want them to build a network based on their tables. Mix them up, and then present to us the principles of their network, the objectives of their network, the strengths of their network, the weaknesses, and how to achieve their objectives. And they can present to us. So I want to start thinking about working together. And then we have the main knowledge, and then you've got your roles, CSOs, barriers, self-participation, gender budgeting, and then we have the advocacy strategy.
And that one, I'll change the scenarios. So shall we remember the issues that were coming up in terms of, we talked about the practicability of having an ADP within 1 day. So how can we allocate to county government so that it becomes a bit flexible? Or in terms of, when you talked about CBEM, the County Economic Forum, and how it can be properly constituted. So I'm guessing in terms of gender disability, so that's also another advocacy around that. And then today I have had supplementary budgets and how we doesn't have public participation. So we also got advocacy around that. So it's real life, so you're not going to do any scenarios. So it's basically things that I talked about but not to address. Yeah. There's one more. Let's see if another issue arises, then I can also pick around it.
They have to come up with a strategy based on this.
Because if you look at Jumila yesterday, she said they've been trying to bring issues to never so what tactics can be used so that they're able to coverage market gender? Yeah, that can still be an advocacy strategy. So how can they coverage market gender within their budget?
Yeah, no, I'm going to talk about WPG. So then they can take that and use it in
Does it also talk about the tactics that you use?
To engage in dealing with opposition. And working with
advocacy strategy can be
I hope you are concluding. We have 5 more minutes. And you shall appoint someone to come and represent your group. 5 more minutes. You've not used your chat. 5 minutes. 1 minute mtapata document. Mko serious? Nakona Asha, nakona Petronila hapa. Imagine it's there. What did you download?
Look at health, not security. Yeah, see, no, 2020, 2021, my dear. Yes. No, it was 2020, 2021. Sindio, mpaka kaniuliza. My dear, wapi? 2020, 2021. You see, 2020, 2021. Kwani ni gani umefungua hapa? Let me see. No. See. Say 2020, 2021, right? Yeah. Iko. Enda tu kwa Google. Itakuwaje ni nini pekee mnafanya 2021, 2022? Umepata? Then you look at health, you look at category number 3. Imagine sijabadilisha. Hata mimi nashangaa ni nini nimewafanyikia leo. Angalieni health. Health naangalia budget expenditures of government departments. I'll give you 5 more minutes because there's another session coming after this.
Five more minutes. Because of group 3, there was some slight confusion.
Just basically saying
Maybe for someone to do like this, like the review, maybe we can go to the next
Yeah. The ones that are available to the whole community. Yeah. Both men, women,
yeah, but she was average 10 minutes late. But it was good.
What else I can't remember? I tried to find it. And then it says access to
There's something
I just feel like my job was a joke.
What about what look at
I don't know, essentially, no, but I really want to work like I really love talking to people, like I really like to actually do this. But it will be a similar style, like do a public affairs, or send a call,
men also are
Can we have plenary? It's 12 or 6.
We finished.
Ah, awesome. Okay. We can start with group 1 as the others are finishing up. Who's representing you?
But we want to
Group 2 and group 3, we are doing plenary.
and it's there. So it's
Group 2 and group 3, we are doing plenary. Sophia. No, are you comfortable there? It's okay, then just get some light. Chunga nini? Ni charger. Thank you, darling. Hello. It's plenary time, kindly. We're starting with this group, group 1, group 2, group 3. Let's give them audience, please. So we'll start with gender-specific programs. And the first one was HIV/AIDS prevention and control unit. Then these two I don't know if they're programs or objectives. HIV, the number of HIV pregnant mothers who are receiving ARVs, and also the percentage of mother-to-child transmission of HIV. The second one was family planning, maternal and child health, the number of women receiving family planning services, and also the number of women delivering at the hospital using skilled attendants. The third one is under the nutrition unit, the number of women receiving iron folate for at least 90 days.
The fourth one is non-communicable diseases control and prevention. And this is the number of women of reproductive age who are screened for cervical cancer. We didn't find one that was addressing the men.
I was going to ask the same. I mean, with regards to HIV and AIDS, I think it affects everyone. So they could have catered for young people, persons with disability. You didn't mention anything? Okay. Do you have questions for group 1? Thank you, group 1. Group 2? Hi. You're not done? Group 3? Hey. 1 minute for both of you, for both groups. I'm sorry. For this team, so what do you propose? What are the gaps? Yeah. As we are waiting for the others.
Men should also be
No, this one is just looking at targets.
Yeah. And it's like we just don't land anywhere.
Group 2, group 3? Okay. Group 2 and 3?
Gender-specific allocation.
Make it copy.
the reason why it is that is for specific.
For you guys, you have statistics. not disaggregated.
I'm glad you think that.
Are you making progress? I was here like 10 minutes ago, you got a document. But you're making progress. 2 minutes. 2 minutes. And then you also identify the gaps. You're done.
Like what? Yeah, but it's today. Yeah, but it's about, yeah, but we should. So if we're linking one budget document to the other one, we must say the correlation. Yeah, the correlation of the two budget documents. Everyone's changed. Then I was interested. Like, oh, maybe you'll show it. It's so much to make. Never have I ever.
You're ready?
So you will text me that.
You're ready? Okay. Group 2 is ready?
This one, like when it says should, maybe we implement a program, may do a work plan that is specific, not just saying.
Go ahead. I guess for you, where is the mic? Oh, you already have the hand. Let me give it to God. Group 2 is presenting.
Thank you very much. So, Group 2 was looking at programs or initiatives that support equal employment for employees of the county. Those initiatives or programs that will help women stay at work, rise to managerial positions, and just generally facilitative programs that address the challenges that women face at the workplace. So, just like the other group said, we identified 3 bigger programs in Nairobi County, and they're broken down to several sub-programs. We'll just give illustrative examples for the sake of this exercise. So, under the preventive and promotive health services, and generally across all the programs, the county has targets on the number of employees that it wants to employ across the years. For instance, for 2020-2021, it's 50 employees. As observed, the issue of segregation is missing. So you wouldn't know whether the county is prioritizing having more female employees or it's the men. So I think the issue of segregation, the disaggregated data rises, and it rises across all programs. And that's like the disclaimer that this analysis would be affected across, because you will not be able to pinpoint the measures the county has for equal employment opportunities in the health sector. When it comes to another example on management, in this program, they want to conduct supervision and mentorship visits, 40 of them. You wouldn't be able to tell who is the target of that, And so it's difficult to conclude whether that has beneficial labor force outcomes for women or men. Staff capacity building as well. Training 200 staff, again, you wouldn't be able to tell who it is. The other examples are quite similar. The curative services or program, they want to train personnel, again, in the general and support and admin. One of the examples that was given was this number of 45,000. They want to keep the staffing costs at 45,000. So is this 4,500? So this millions, is it people? The unit of measurement also was not clear to us. The rest of the examples about the health personnel training is also the issues of disaggregation. You wouldn't be able to tell. What also I think is important to note, there's the really concrete or well thought gender interventions. For instance, what's given in the examples you gave of maybe like a creche or parental leaves, those interventions that go the extra mile to actually prove that the county sat down and maybe conducted a gender analysis, identified some issues that prevent women from getting into the health workforce, and have programs are not in this budget. In a nutshell, my colleagues can also add.
Thank you. Any reactions, additions? So, I think when you're going back, there's a lot of advocacy around disaggregated data. I think now you see why we need disaggregated data, because we just have figures and you don't know what those figures represent. So disaggregated data, even going beyond men and women, the Constitution says that 5% of employment should go to persons with disability, but we can't quantify that because we don't know who they are employing. Yeah. Last group, but not least, group 3.
All right. Thank you. I think I need to. Yeah. So for us, we were working on the general, or rather the mainstream expenditures, and we were able to identify. We don't see mentorship on positive general health behavior, and then also one gap that stood out is that the lack of allocation on gender specific information, allocation, right. I hope it is clear. Maybe someone can add from our group.
There was a point that you're so passionate about, but I don't know why you've not mentioned the place of men in sexual reproductive health budgets. Yeah, so there's no that intentional mention or progress made to like even bring men on board in terms of budgetary allocation. Because men can impregnate a maximum of 50 women in a day, but a woman will only give birth to one child per year. So I think we need to shift that narrative and start an intentional effort in targeting men on sexual reproductive health that our budget is not speaking to.
Group 1 had identified that as a gap. Yeah. Maybe you can go through the gaps quickly, and then I can leave it to Hannah to take us to the next session. I don't know, I'm not a Tell us.
30 seconds. I'm just asking if how practical is it that one man is getting 50 women in a day?
It's very practical.
In a day?
There's a 23-year-old I was reading about.
In a day?
Wait. 23-year-old who's expecting his 50th child. What?
In a day?
Now, I don't know whether all of them will be game short, but it's very possible.
It's not possible for one man to sleep with 50 women.
We don't know. We need to do research. We'll have to do research. Sophia, take us through your gaps.
It's part of the camp.
The mics. Can I have this, please? Thank you.
One of so what report framework like numbers once they had that group has identified, don't know what percentage women and about this other one we identified that gender specific expenditures not necessarily mean gender. So we said there were no men policies. The last one was initiated and not policy. Like when it talks about women, it only talks about women of health. How about others?
Thank you. I hope now we are able to analyze budgets using tools. Yeah? So that was Rhonda Sharp. You can also use the 5-step. You can also use Dan Elson. I'll share the slides. We'll put all this together for you by Kesho so that you're able to have these tools even for your future reference. And Josiah had asked about gender analysis, gender impact assessment, and gender audit. All those are tools, so you have to apply them somewhere. So I'll also share them for you, because I don't know if you have time for me to go through. Like I know, like for example, gender analysis, you have so many frameworks. There's MOSA, there's Harvard. So they're all tools that you need to apply somewhere, just like GRB tools. You need to apply them somewhere. So I'll share ISO. Then maybe if we have time tomorrow, maybe I can take you through quickly. Yes.
The health sector in Nairobi County is one of the sectors with very organized data. You realize that this is just a budget, and it is a budget estimate or proposal as we call it. If you want to make reference, we have other documents which actually we can link to these figures.
Okay.
You can look at our CADP and also ADP. There are so many annexes of head.
Okay.
Otherwise, this is just a summary.
Sawa. So you can also look at CIDPs and ADPs for if you want data with regards to Nairobi County. Thank you, Personally. I'd like to thank you so much for your time. I'd like to I'd like to bring on Hannah for the next session.
Thank you, Lucille. Hi, everyone. How's everyone feeling so far? Good? Tired? Okay. I'm going to ask you, we're going to take a bit of a break from the gender budgeting stuff, and we're going to cast our minds back to yesterday's policy discussions. I'd like everyone to go back to their original table where they were seated, because those seats were deliberately selected for this exercise, because it came out yesterday that people have a very good grasp and understanding of paid and unpaid care and the impact of unpaid care on gender inequality. So we've kind of put together this exercise, and hopefully it will work. If not, very welcome to feedback on an alternative way to do things. But in your tables, I'm going to assign you all a government area. So we've got divided it into tax, trade, agriculture, and health. And I want in your groups, you'll have 25 minutes to use the flip charts to be able to present to us a gender-sensitive policy initiative that aims to tackle unpaid care, so the impacts of unpaid care. So from your understanding, what impacts unpaid care has on women and men, and then if you are in this government department, if you're designing a policy initiative on tax or trade or agriculture or health, how would you design an initiative that aims to reduce the impacts of unpaid care, to alleviate the pressures caused by unpaid care? So unpaid care at the centre of the policy. Then I need you to, I'll give you 25 minutes to design an initiative, the principles of the initiative, maybe how you would implement it, what you need in order to implement it, and then present to us back to the group why you've chosen this particular initiative and how it tackles unpaid care. Does anyone have any questions? Have I been clear in my explanation? Yeah? Okay, so I could ask you to go back to your tables that were specifically planned based on your areas of work and expertise, so that you all have different strengths and experiences, so you can help each other to design a policy initiative. Yeah, okay, good. One more. Yeah. And be okay.
No, you can hear. Yeah, it will be groups of five. Were the exercise instructions clear enough? Or do you need some more elaboration on the exercise? Is it clear? Yeah? Okay. Do you need 5 minutes break before you go into the exercise?
Maybe you can just say it again.
Yeah?
Okay.
Okay. So, yesterday, when you were doing this exercise with the fictional woman that you were designing policy for, it came out that unpaid care was at the centre of a lot of the issues that you were identifying as like barriers to gender-sensitive policy implementation. So, if you imagine that, I'm going to assign you, so we have, Ebian, you have the chart, I think, but each table is going to design a policy, so either a trade policy, an agricultural policy, a tax policy, or a health policy, tackling any particular issue that you decide amongst yourself, but with the impacts of unpaid care at the centre of that issue. So, for example, yesterday we talked about trade and the impact of unpaid care on women traders, especially going cross-border. And people were coming up with policy suggestions for what would improve the impacts of unpaid care, so an improved trade policy. So along these kinds of lines, okay, so an agricultural policy would be similar, a tax policy that would aim to tackle unpaid care would be something like incentivizing or like having tax breaks for women who are at home not working because they've recently had a child. So anything with unpaid care at the centre that would seek to improve the impacts of unpaid care on women, but a policy initiative. So you have 25 minutes to discuss in your group and then present back to us why you've chosen this particular policy and how it improves the impacts of unpaid care on women.
So we've assigned departments to each table. So table 1 in the back, Josiah's table, we've got tax for you. Table, let's say number 2, we've got trade. And table 3 over here, we've got health. And table 4, we've assigned agriculture. See that? I forgot to assign the thing, that's why I'm looking at this.
With the context of our book in mind. And then we are looking at the date. So when we are kind of what are the policies so that we are able to look at how do we ensure that this unpaid space is actually considered in the policy? Not the whole policy. For instance, if you have ability to how much you should bottom line, then the same level provided by my problem because that is your normal duty. But when I take care of the child, just all our domestic responsibilities. If we have compensate, leaves out without scratch, what is the consequence of that? We take gas, form 4 liters, she's jobless. She's finished her day. She has just registered to move over. What is it? But this is the typical. So those are really the ones that you see those that come to Nairobi and shifted. They have gone to school. Those jobs they have done secondary the level which is class 8, not had opportunity to proceed. She's instead of this person coming, Alain is just moving. That is the that you can afford to run that person. The free walk where she can become a tool for every man. Then she's a bit safe to take care. Then number two, what she is actually pushing her such kind of it's most probably they cannot afford to bring of them because they have possibly a family of 5 children and a 2 parents. So, and in fact sometimes it's the parents who push them out and say, end up to something happening. Yes, by the way, it's possible. Women of here have a huge wage, but in the rural areas where you get the rate is unheard of. The same with for performance. You're waiting to get the background is actually you are coming from both foods, socially, and all those other things. What happens? You look for something that facilitates you, either to enable you to get go for certificate and or you didn't make the kind that you got is not very important to the process. So before you become a hospital, you have to see how you get a facilitates you cheap work. Now what are you thinking? Is that because of aesthetics? Economics of that makes and then again the attention. I don't know the house not a three or 4 taken and the 2 then the work is to most lunch essentially and most of these offices are not functional. It's art lost. So there's
but still enable Just to kind of basically have a side hustle business. We don't want them to run an institution where they give them. Now they have to find out between food and other disciplines. So if we can remove the expenses which is trying to other quality services to go there and ensuring that you can actually have a balance because that's another thing and also family and students to understand. So maybe something to be when it comes to children. Yeah, how much money is
It's actually really valuable. No, no, it's really valuable.
You have to be flexible where anything just to be reduction, because something you enhance it. Just
I'm telling you, are we taking the policy as two separate ones or is it
that's harassment.
Yeah, I said like just have the next
It's silent as much as standards. Everyone is supposed to be. But who is following? Because that's the direction that now nobody knows. Employers, the family,
Hi everyone, you've got 10 more minutes. We encourage you to use the flip chart so you can present back to us. Yeah, so 10 more minutes. No one's getting extra minutes this time.
She's always like,
so you wonder what is enough time. You try to calculate all over what you say, but it's truly not
chronically, the mom now counts the child process. Okay. So the concept
for women in general, this is
what about
Or kids forces.
London is there.
So it will bring eyes to even what the student does. Or that still where the right It's about because I'm really working and we have to take care of the children and we have them mostly depending on your husband, maybe family members or whatever, what the police where it's difficult to categorize how you identify a single mother, someone who's not employment. And the idea is also to encourage people to get employment to be able to provide for themselves. So how exactly. Yeah. So now of the affirmative action. Now, how do you flexibly that? Because when you take oh my God! For them to be able to contribute to the society, the community,
But she doesn't look like this one. The way that you said it was not exactly what you meant.
Yeah, because also CHVs, the conversation that is that they actually get to do that. But they're not interested. I know, they're paid. Yes, they're coming to factors being given like 200 days. So you see, when we program, they are out of a job. So we should wait for them, sort of give them, like a continuous, we can tie those two together. Because it's still because that's the level where you can actually that's where you can venture. Everything is styled. Also, bring some macaroni. So the government is supposed to feed you, but it's supposed to know the kind of monetary needs that also, the kind of vaccines they wanted from money and all and all that to ensure that it is susceptible to getting polio and all these things. HVs was, I think they did a good job. And there'd be less people practicing as compared to now. They're just not doing it. It's very, they need the government to collect data. That's something they need.
One thing. You can put it like that. Only see
Tell me where you should take it. Because he still hasn't got it. And I feel like my friend doesn't got it. And they have to do
They will get into agreement with one of the daycare students. If you charge 100, then the government
how are we doing? Are we ready to come back and present, or do we need a couple more minutes, or what are we thinking? You want to come back and present? Oh, okay. Anyone else? Ready? Yes? Tax? Yeah? Yeah. Maybe 2 minutes.
Another one was train so awareness. No, separate. Develop. Develop. Yeah, that should be a policy.
They stop who feels
so this policy calls another policy.
If we put the terms of the phone,
Okay, we'll call you back into the room. We'll start with trade. You guys said you were ready? Yeah? Okay, so I'll give you a few minutes to present this policy initiative.
Thank you, thank you. As our part is just very brief, and I'll start with yeah. So we thought of up to like 5 policies that could interventions that could be put in place to support unpaid care work, and especially to women, of course. So one is that we think that if we have subsidized certification and fees for women traders, that would mean that women are not paying so much compared to, of course, the other side, and you know also for them their kind of trade is not so huge. So if you give them you subsidize their certification, it will be of impact to their business or their activities. So the other one, from the example that I gave, or we gave as a group yesterday, we were talking of tax issues. Women, for example, in those cross-border trade, who are going through unofficial routes which are long and tedious to avoid paying tax. So these tax are punitive in a way, and so we wish that or we can have a tax relief for like 6 months to enable these women to stabilize, for those who are starting business. And also, if they are taxed, they should be not so high for them. The other one is social protection programs targeting the informal economy. Yeah, there could be a policy to protect those small economies, the informal economies, and then also mainstreaming of child care policies in the marketplaces. And the good example that we were given here by Purity is that, for example, in Kiambu County, and some counties have done it very well, we have a creche program, and we also have like a room for children who are breastfeeding. So those are among the policies that could be put in place and or enacted if they are there. The other one is also complementary policies. So here is we wanted to compare what does a mother or a trader who has a child in a market needs. So if you're bringing a child to the center or to the market, you need someone to look into your child. So you need child care. The other one, you also need health issues. If your child is sick, you need someone who is around to respond to the sickness. You know, of course, if there are many children, they need someone to do the health or checkup. And then the other one is also health trade and ECD. So we are talking of also children who are, children are growing at different levels. So we were saying that if there could be a policy that complements now the children and the trade, like we have an ECD specialist recommended from the county because it's a devolved program. So we have a policy that if you have a crash in a trading center or a marketplace, there's someone recommended from the county to like take care of the children in that level, the experts in the ECD program. So I think that is all from our end. Unless there's something that I've forgotten or I didn't explain very well. Any? All right. That's all for us. Thank you.
Thank you, Department of Trade. We assigned sort of one initiative, but you've come up with quite a few different ideas, which is good. The more the merrier. Does anyone have any response on the policies that they've listed? Anything that they've missed?
Any questions, reactions, interventions, something you'd like to know more about? For example, I have a question. How would you incentivize childcare policy in marketplaces? Would it be a legal requirement? How would it be funded? What would be the incentive for marketplaces to mainstream having childcare facilities?
Yeah, one should have a policy that requirement that every other market should have a creche or a childcare center whereby parents, or rather, the parents that are working on the market and they don't have someone to employ to look after their children, they're able to come to the market and they can place their children somewhere and they're sure that they are being taken care of. Yeah, so from the government, actually the county government. Yes, and maybe someone to.
I just wanted to maybe reiterate what you're saying. Probably because ACDE, that's which is like responsible for that and establishment of those things, normally is devolved. So probably increment of the budgetary allocation to the county. I think that would work.
And I think this is the kind of policy that you would demonstrate that would pay for itself, because the increase in trade profits and the revenue that would create would pay for the childcare facilities and the cost of running that. So this is the kind of questions that you'd have to convince people before passing this policy. But thank you very much. I think it was brilliant.
So now the incentive, not just for the mother, because the mother will be more productive when the baby is close to her at work, but also the incentive for the county is that that woman will not leave her stall in whatever stage she is at. So, and I think also the place of, because now when you talk about the child care, we are also considering the factor of children between 1 and 6, because the government only recognizes the ECDs from the age of 6. So, but now there's not that attention to children below 6 years. So also encouraging the government to now start like thinking through on how to take care of children between 1 and 6 years.
Maybe I can add on what Purity has just said. We have a policy, it is in the pipeline, taking care of 0 to 4 years. Yes.
But maybe not counties. Nairobi has done very well. You know, it's a capital city, so it may not be reflective in the other counties.
It's across because the lead is the government. Government is the one reading in that policy of age between 0 and 4 years. Yes, so it's across all the counties.
Okay, so across all counties. Okay. Thank you. Thank you very much. We have a round of applause for our Department of Trade.
Okay, we'll go to the Department of Health next, if you're ready.
Hello everybody.
Hello.
Hi.
So we have the Wanjiko healthcare policy. And we have a formal and an informal setup. So for the formal, we thought what the Scandinavian countries are doing is very commendable, and we thought that it would be interesting to actually see if we can enforce a 1-year paternity and 1-year maternity. Francis is on our table and he's asking us, really, like, we expect a man to go at home. Even 2 days of the weekend is a long time. But we think it's an interesting place to have the conversation begin as to where healthcare and childcare really lies. Is it the responsibility of a man only? Is it the responsibility of a woman only? And say, for example, I pass on, unfortunately, as I'm giving birth, then what happens to that child? So at some point, then the man's psyche needs to really adjust like overnight. And so we think this is a very good place to start. Under the Wanjiko Healthcare, we also have a Nyumba Kumi initiative or healthcare initiative. And this is really spearheaded by the community health volunteers. And we were proposing that NHIF premiums for nursing mothers or new mothers, and these would be benchmarked on what happens in a formal setup. That is 3 months of maternity currently and 1 month of the annual leave. They would waive those premiums for nursing mothers or for young mothers or new mothers for the duration of at least 4 months, benchmarking on the current practice right now. We also thought that under the Nyumba Kumi Healthcare Initiative, we would be able to enforce access to healthcare for elderly. As we know, we have it on paper that our old people can be able to access healthcare without paying for the NHIF premiums after they have attained the age of 70. But the reality on the ground is not the same. So just being able to enforce that policy as it is. Then we also thought that under the Nyumba Kumi initiative, again steered by the community health volunteers, would be able to have discussions similar to what we have in Nyumba Kumi around security, but now on healthcare. So basically looking at preventive health. We're joking and saying the Kalentins have been doing charcoal for a very long time. And today, every person who's manufacturing anything for eating, for skincare, for brushing our teeth is trying to put charcoal in there. So if we could find a way, a communal way in which we could just sit down together and say, why do we need to have fish? What is it about fish that needs to be in our diet, as opposed to just plain ugali skuma? Why should I eat rice? Why should I eat chicken, and so on and so forth, so that we begin to have an actual healthy conversation in the community, guided by someone who is within that frame of healthcare. And we thought that if we could start even maybe the healthy conversations, why do we need to exercise right in the house, right in the community, and encourage each other, that then these other higher levels of diseases would be taken control of. So similar to what we had over COVID, where we were told these are the signs to see that you suspect there's COVID. What are the signs for me to see that my dad might be getting a stroke? Why, what are the signs of around mental health to prevent things like gender-based violence and stuff like that? So just having those conversations from a healthy perspective, where we're not having it aftermath when this guy killed all his children and wife and then killed himself, but we already started having conversations around what we need to look out for in advance and in a safe space. So it's within a community. So currently these CHVs take care of about 100 households, and those are people who actually hold a lot of that gender disaggregated data that we're talking about. So they would know which family is expecting a child, they would know which family is a single home, single parent, child-led family, and so on and so forth. So at this very level, if we're able to have good conversations that are open, then we feel like a lot of our health issues would quite improve.
Okay, so I'm seeing on the third one, you're veering towards, we'll talk about it more tomorrow, but advocacy strategy to support a policy change. And this would be talking about behavior change, community change, and it would require a communication strategy that would need to be supported at policy level. And you would convince people by saying, this will pay for itself in terms of the cost you would save on healthcare by switching to a more preventative model rather than a treatment model. Okay, I like it. Does anyone have any other comments, questions, interventions? Do you want a mic?
Thank you, Anjiko, and your team for the good work. Being someone who really values matters social inclusion, I don't know how many of us are aware or that persons with disability, their assistive gears are not insured by NHIF. And for them, you know how they use their metal calipers, their wheelchairs, their crutches, that is part of them. That is like how you put on your clothes. They'll always live with that, but it is not insured by NHIF. So I think in our various spaces, we need to voice this out for the voiceless. It's a conversation that we've started, but I don't know if NHIF could think about insuring assistive gear for persons with disability, because they're very expensive. Yeah, and it's something that they need. Number two, in the county hospitals, the facilities are inaccessible to persons with disability. If you go uko mashinani, I don't know how Nairobi is, issues like a ramp. If you don't have a ramp, then someone in a wheelchair cannot access it. If your toilets are not, you know how the toilets are. I've been to those toilets in the rural areas. A person with disability will not go to a health facility because the toilets are not friendly to them. So they'd rather stick with their disease or go to a traditional herbalist to see them, because they know, number one, if I do eat and I do get to go to the hospital, they need to research on that. They will not eat because they know the toilets are not friendly to them. So it's an issue. So those are some of the things. When you go on the ground, in the various spaces that you are, please voice it out so that we include it in the budget, especially for the health facilities. Thank you.
Thank you, Lucille. Everyone, do you have any? Yeah?
I had one question about how you would convince the government to fund for 1 year maternity leave and 1 year paternity leave. In what way would you convince them to pay for such a policy?
And my team is welcome to jump in. I think for me, it's really...
I think for me, it's really a conversation around, similar to what Njoki Ndungu, one of our former members of parliament and now a Supreme Court judge, did, is to actually tabulate the numbers. We are having a lot of maternal mortality, and those men are actually finding it very difficult to adapt. And you know, this is really beyond a lot of our circumstances. We're having more women going through birthing by operation. And so these women ideally should not come back into an environment of work. They would need the support of their husbands. So then how then would they expect it to happen if their husband comes home for 2 weeks, which is the current practice, and then goes away? In 2 weeks, I'm not yet healed as a CS patient. I still have a small child. There are probably maybe other children in that home. So then how, again, do we support this? There are also incidences, a lot of incidences where women are suffering complications and have to be in hospital longer. So then how, again, how is the balance going to be? So because a lot of these things are in the hands of men in terms of decision making, it would be easy to quantify, like the number of women who have to be in hospital longer, the number of women who are dying, the number of women who are actually going through CSs or cesarean sections for birthing, and then ask a fair question. If this was your wife, what would you want? And I think that would be the very starting point or basic point of convincing the government. we also had a fair conversation around those who are self-employed, or in Busia, for example, where both husband and wife are farmers, and they wake up, they go till their land, and then they come back home. Is it really viable for them to have 1 year off tilling, and how will they survive? And so we agreed the only way to enforce this would probably be in a formal setup, but in the informal setup it may not.
Yeah. Thank you.
Yeah, I agree with her, the whole idea of using data and real life case scenarios to make your case. And if COVID is anything to go by, it's taught us we can work from home and still be productive. So, I mean, the year off can still organize yourself to be able to still contribute to revenue generation.
Okay, thank you. We'll move on. Thank you to the Department of Health. That was good. Okay, so we'll go. Yeah.
Sorry, I had a question for them, if you would allow me.
Okay.
Did you consider issues of commodities that are used in the hospital, the medicines and other equipment, and also issues of workforce? Because I think they kind of hamper access to healthcare services, especially at the very primary level, dispensary level of the facility.
Okay. Thank you. Does anyone make a comment?
Possibly to say drug dispensation, for instance, at the level 2 health facilities are not chargeable. But what we may say, we didn't give a consideration on at the work CHVs actually do at dispensaries, but we gave a consideration that health service provision at dispensaries is purely given by nurses, but supported by the CHVs or the casual workers, who are given a stipend, but not even a salary, because most of the time what they are paid as casual is less than 5,000, which is actually to sustain their being there, but still very little against the work they provide at these health facilities. So drugs are not paid at dispensary levels. That's what the input I can add.
Okay, thank you. We'll move on to the department. Is there such thing?
So we did not come up with the name of our policy, but we did break it down similar to Wanjiko's health policy, both formal and informal measures that we would be able to. I hope everyone can see, yeah? So just starting with the formal sector, one of the things that we agreed is, sort of individualizing, taxation measures so that they're responsive and also are gender sensitive. So the first one is the reduction of the personal income tax on women in certain brackets. I think one thing that has come out is that women, in spite of being in the same level as men, tends to earn less, especially in the corporate sector. So just incentivizing. So we didn't come up with a figure, but one of the recommendations was, just reducing the personal income tax. Currently at 30%, so maybe 28% or to 25%, similar to what the government did during COVID times. And then the second one was targeting companies and ensuring that the private sector is well incentivized once they attain certain quotas of hiring. Essentially, what we discussed was, for instance, if a company is looking to set up shop or is looking for a tax break, for instance, giving a certain percentage of women in leadership positions would then be a qualifying criteria. So for instance, maybe having 30 or 40% of women in leadership positions would then, a company could then qualify for maybe a 3 to 5 year tax break, or even more, because as we know right now, a lot of companies are getting a lot of tax incentives and exemptions, yet if it's for questionable reasons, so even 10 years, right? And this would then have a ripple effect, as the assumption was women in leadership would also support other women, to sort of scale up the ladders, but also, having women in leadership means that they also have an increased income, so they're able to afford nannies, they're able to afford daycares, and so on and so forth, and also good education and health outcomes for the people that are under their care. The third one is the reduction of excise duty on certain goods that make care work manageable. So, for instance, someone mentioned washing machines, baby products, wheelchairs, because we're also looking at care work for the elderly. So I think we don't tax wheelchairs, but that's because of people living with disabilities. But then also, there's different wheelchairs for, categories. And then the fourth one is tax relief for women on maternity leave. So this one goes hand in hand with, the reduction of, women in different tax brackets, but also women in maternity leave could possibly be given tax, a bigger margin of tax relief. Those arguments that also for paternity leave, but then we couldn't differentiate whether men really support in the care work during this particular period, so we left it at maternity leave. And then also subsidized daycare fees. So we do have private daycare facilities and also homes for the elderly. So if we subsidize the cost, for instance, if per day a parent is supposed to pay 200 shillings, the government then subsidizes maybe half of that amount. Like the Unga situation. I know you all remember the 100, I don't know who was able to access the 100 shillings Unga. So that could also work in this particular scenario. In the informal sector, obviously reduction or complete removal of cess fees for women-owned businesses, but also small-scale and medium enterprises, which majority of them are run by women. Also, zero rating on certain goods such as gas. I think we mentioned that a big time use percentages spent in cooking and trying to prepare meals for the people that women are taking care of, or rather households that have unpaid care work responsibilities. So zero rating on gas, I think would help make the process a bit more easier and faster. And then last but not least, also the government could subsidize daycare and home for the elderlies that are, government owned. So ECD centers, there's still a cost that's associated with the ECD centers. So maybe the government could also subsidize. We didn't want to also go to the spending part where government can increase spending in some of these sectors to improve outcomes. But I think the people who did the health policy, I think covered it quite well, as well as the trade. Yeah, so that's pretty much it. In case there's anything else.
Thank you. Does anyone have any thoughts on the policy of reducing PAYE tax for women? Because it is a controversial one. Yeah, I know that we have like preferences, but like from a discrimination point of view, how do people feel about how that would pass? And are there any equalities laws in place that would prevent that from taking place? Anything that we would have to consider? Thoughts, reactions? Yeah.
I'm just thinking, there's no law, but it's a really nice one. I was telling Calvin, from what I know and I've interacted with, in a family setup, the husband takes up the responsibility of paying rents and school fees. Then the woman is in charge of food, clothing, and paying the nanny. Right now, our food prices are just another thing. So currently, the Kenyan woman from last year, since COVID, we are investing double in the family setup. But our husband's investment, it is still constant. So I think that tax is really a good area, but I don't know how we can influence it.
But I think the solution for that is reducing the cost of food, because mostly that is what affects the women. That would be very effective. Yeah, unless on the other end we have families that are led by women. We don't have an husband partner. So, okay, long run, reduction of pay is crucial. Yeah.
Okay, thank you. I think Anita, you have one comment.
Yeah, I think it's good because it's affirmative action, but there are some maybe unintended consequences that it may cause. That now more women will get more money, and then people will be encouraged to maybe employ more women because you pay less tax, and that which means in the end the man will be discriminated against. And we know that we have households where women work, but if you talk to most men, they tell you, my money is our money, but my wife's money is her money. So what impact does that have on the family life as a whole? So I don't think it's a good thing, especially also on point of equality. I do the same amount of work. She does the same amount of work, but she gets more money just because of her gender. Yeah, so I don't think it can have unintended consequences in the long run. Yeah.
Response from our tax team.
Point of rebuttal, eh? So yeah, that's why we said certain tax brackets, right?
Yeah.
So we're looking at possibly putting a cap on what, because you see, if we're trying to support women in leadership, there's no way you're going to have a woman who's the MD also, pay, let's say, 28% instead of 30%, because she's already possibly competitively paid. And obviously this was a bit of a radical policy, but at the end of the day, we're really trying to align it with care work, right? There's also people who are arguing that there's some men who are obviously the ones who are the sole providers and also the ones who are giving the care work itself, but we're looking at the percentages, right? It wouldn't possibly be a bad idea to have more women in leadership positions because of companies trying to save on taxes. Maybe that's the affirmative action that the the corporate sector needs, right? I mean, that was what we're thinking, but obviously governments would never agree to that.
I think the corporate tax reductions to incentivize women in employment is a easy policy to maybe to pass, to argue for. PAYE tax reduction on women, more difficult. But what if you changed it so that it would be a PAYE tax reduction on certain professions? So then you don't tie it to a gender, but you focus on the professions where women are more predominantly working. And then in that way you also incentivize those professions where women are found to be in work. Just a suggestion. But yeah. We have not long, and we are way past for lunch, but I would like to give our final Department of Agriculture the chance to present. But also before that, can we say a big thank you to our Department of Tax for radical policy. Thank you. Agriculture.
Right, so the Department of Agriculture, and we named our policy integrating gender in agriculture. We went for a more gender inclusive kind of policy instead of gender specific kind of policy, and we identified several problems that would affect the quantity and the quality of work of a woman that is working in a plantation. So this is a woman that is employed in a plantation, and there are several problems or issues that would affect the quantity and the quality of work that she will be able to do. The policy goal is meant to address unpaid care work and its impact on agriculture. So the first prescription that we came up with was that we are addressing is on gender-based violence. Gender-based violence is, we looked at it as incorporating sexual violence, physical violence, and also emotional violence. So when it comes to emotional violence, you can have like the management level, the people at the management level harassing the women. If you don't do a specific favor for me, then your wages will be affected, or you may not even receive your wages. So we came up with the idea of having to develop a sexual harassment policy. So it's a policy within a policy, and then we'll have the lighting at this stage. So when the women, we imagine this scenario where it's lunchtime and the lady has to, or the woman has to go back home to prepare lunch or to prepare food for the family, and to maybe clean up and take care of a few other things. So they may end up having to pay back for that time that they have lost. Maybe it's if they leave the workstation at 12 and come back at 2 or 3, then they will end up having to work past the normal working hours. They may have to go back home at 7, which at that time it is already dark. And so improving the lighting or the street lights. If there were no street lights, then there should be established the street lighting in the streets. And then there's enhancing security patrols within the plantation to ensure the safety of the women when they are working amongst the male counterparts or the workmates. And then the other tenet was to create awareness on gender-based violence. This is for both the males and the females, so that we can address the issue of gender-based violence, especially at the management level and even at the workmates. A second prescription. Oh, sorry. We didn't get to write it, but it's on family and child welfare. We gave the recommendation of establishing childcare facilities at the plantation. This would save on the time that the women would have to go back home, would have to go back to the childcare facilities that are outside the plantations. So instead of having them to go out to tend to their children or to go and check the children at the daycare facilities outside the plantations, then we can have, or they can establish childcare centers or facilities at the plantations. Then we also gave the tenet of having a flexible work arrangement for the mothers. That would be inclusive of a maternity leave, because in such plantations you'd find that getting pregnant or getting sick is guarantees that you get sacked in such plantations. So having a flexible work arrangement for the mothers, where they are guaranteed at least 4 months leave, maternity leave, so that they are protected. The next tenet that we addressed was on remuneration at the plantations, where the wage gaps would be addressed between the men and women, where in most cases men get to have higher wages because the assumption is that they have more time, or they're able to concentrate more on their jobs because they don't have much that they're thinking of. But as for the women, at one point they will go back home to take care of the children, or maybe even when the children come back from home, they may end up coming to the plantation to take on their mothers, and maybe to take instructions on a few things to do back home. So the concentration levels for the women may be a bit lower than the men who don't really have much to think of. So when they get the job, that is all they will be doing. So this also affects the quality of work for the women. So that may also affect the gender, the pay gaps for the men and the women. So that is a question of remuneration. And the next one is social amenities at the plantation. So that includes the schools and ECD centers or nurseries at the plantation to reduce the time that the women have to, because in most cases we have a scenario where it is the ladies or the women that go to pick their children from the ECD centers. So if they would have the ECD centers at the plantation, then that would reduce the time that would address the issue of time for these ladies. So that we unanimously agreed that the one key factor, the one determining factor for the quantity and the quality of work for the women is time. And then there's the health clinics, because for the women, and then the accommodation at the plantation for women with families and children, so that they don't have to walk long distances to go home, to go and take care of their children, to go and take care of household activities. When they have to leave work, or maybe during that break from 1 to 2 lunchtime, they can just go within the servant quarters, and that would address also the issue of time. So we've mostly addressed the issue of time for the women, which impacts the quantity and the quality of work that the women produce at the plantation. Thank you.
Thank you.
Yeah, and we had a question as a group. It's about the policies. Would we rather have gender-specific policies or gender-inclusive policies when addressing this issue of GRB?
Does anyone have any thoughts on that question? I also, before I ask, I wanted to say that I thought your policy was very comprehensive. You had like 5 or 6 policies in there, but also there was, the crossover between health and your agriculture policy. which is the same as your crossover with tax and trade. So it really signifies how a joined up policy response is the most effective way to implement gender sensitive policies. Standalone policies won't make the impact that you're trying to achieve. But back to the question that was posed to the group, should we have gender specific policies or gender inclusive policies? Yeah. Thoughts? Kasha?
Maybe to try and talk about the question raised, I think we need gender inclusive policies because policies impact differently on different gender. So we need to include all other genders, not just focus on one specific gender per se, but having a policy that integrates the needs of women, men, the vulnerable in the society. So we have an inclusive society without making other people feel vulnerable, marginalized. So we have a gender inclusive policy. But maybe I also wanted to say something about the presentation. When they talk about issues of GBV, I look at that as a form of maybe look at modern slavery, more specific to the agriculture sector, because modern slavery issues takes into account low wages, mistreatment of workers at those, especially those who are vulnerable, and working in the sectors, the ones that do not have high income. So also the modern slavery concepts take care of issues of mental health, because so in the modern society, we speak about modern slavery, whereby we see the unequal treatment of workers because of their gender. They are vulnerable because of maybe they earn less than others, because they are marginalized, because they are vulnerable. So for me, it's much of addressing issues of modern slavery in terms of identifying the gaps that exist within the various sectors in the agriculture. So if it's in the tea industries, if in the flowers industries, coffee industries, so just looking at the gaps that exist. And also I just remembered something about a point you said yesterday, that we could have a policy at the bigger national level, but if that policy does not work at the very local level, then it doesn't make sense. But then I remember in Kenya we have what we call Intergovernmental Relations Act, where the two levels of government work together. That is why we find when we come to budget issues, if we have a Big Four agenda or we have a BPS, it corresponds to a similar budget document at the county levels. So now what the counties do is they domesticate the policies at the national levels based on certain issues that work for them in their specific counties, because what might work in one county might not be what is working in another county in the same national policy that we have. So for instance, I come in from an area where there is a lot of terrorism. So we have what we call National Counterterrorism Strategy, National Counterterrorism Strategies, but the counties have what we call the County Violent Extremism Action Plans that are very specific to their counties of operations. So somehow borrowing that idea, but domesticating to making sure that it works for them at the local level, taking into consideration all the cultural issues and social behaviors.
So in this case, then the process from an advocacy or a gender sensitive point of view would be to monitor that process of who is doing that interpretation, who is at the table when they're deciding what is relevant to the local level and what isn't. It's all about who has a voice in that process to implement from the national to the county.
Yes.
I understand. Josiah?
Yeah, I wanted to answer the question on whether gender specific or gender inclusive. And it's my comment that these things have many dynamics. First of all, if we have an advocacy agenda, we have to be alive also that the other politics and interests are at play. So what would be most strategic at this point in time? So you move like with societies. There is a country that you will go to and propose something that's completely gender specific, and it will make sense to a lot of people across gender, because that is where the norms, the practices are at that point in time. And then there's some communities you will go to and you propose something that you face a lot of your resistance, and it will take you years to achieve what you want. So where we are at right now in Kenya and in many communities calls for a lot of strategic positioning, being very smart in what you're doing, especially if you're to realize any results. I like the examples that we gave today. For instance, where are women concentrated? Where are they concentrated? So can you target those sectors with those kind of policies that you want to push forward? The other example that when the agriculture department here was presenting, you see, they're saying they're addressing the question of time and somewhat productivity, which makes a lot of sense to a plantation owner. So just having, what are the issues can you push to specific stakeholders that will be, you have the buy-in that you deserve. But if we were to apply the textbook knowledge that this is how you do a gender mainstreaming, and you might not get a lot of results. So you have to be alive to what is happening around.
Yeah, I completely agree with you. Again, tomorrow we'll focus on advocacy strategies, but before I'll let you speak, before we go for lunch. This is an issue for many civil society organizations. What do we push in order to achieve results, and what do we stay focused on because it's our principles? So some of the time you'll know what will be buy-in, you know what will achieve the results that you want, we'll get a policy passed, but maybe in the long term it affects your long-term strategy and it doesn't achieve your principles, your objectives. So you always have to balance quick wins with like long-term, I think. Eve, you had a comment?
Yeah, when I was listening to their presentation, the context of farmers in rural areas, but we can also consider urban farming, because it was stated by someone that women are the ones who have the responsibility of providing food. So we can have a policy whereby we are encouraging extension officers to have like programs or sessions with both women and men in urban areas, because of course when you look at population and data, more people are moving to urban areas as compared to rural areas. So we can also try to instill that culture of having that kitchen garden in your home for you to be self-sustainable when it comes to food security.
Yeah, definitely. I see comments, but I also am seeing hunger and I'm seeing tiredness as well. So with that in mind, if anybody has anything quick that can be said in 1 minute, please feel free. Otherwise, I would like to invite everyone for lunch, so make of that what you will. Would you like? Okay.
Yeah, just thank you for that. Just a minute. We have the minimum wage bill law, which I think is not effective. Yeah, I think that could be, I don't know, enhancing the law, I don't know, or implementation. That's my point. Thank you.
rejoinder on the issues of modern slavery, I think we need to call out GBV as GBV and not cushion it under modern slavery.
Yeah.
If someone is asking for sexual favor and this someone is superior to me, that is sexual exploitation. It's not slavery. GBV is GBV, and we need to call it as it is. That's it.
Okay, thank you everyone. You've all been given your lunch vouchers, I think, at the end of the now. So if we could go down for lunch, and then I think we're taking a group photo after lunch. So if we could meet back up here outside the room at 1:50, so 10 minutes to 2. Slightly short. Sorry, 3. 10 to 3, so 2:50. Slightly shortening lunch to make time for the photo.
Is it?
Number 8 is not the one I sent yesterday. Is it? I sent one yesterday. It's okay, let me just read it. So I asked, how can the government utilize existing tools or develop new tools and mechanisms at the national or county levels to address the current implementation gap in GRB? How can the government utilize existing tools or develop new tools and mechanisms at the national and county levels to address the current implementation gap in gender responsive budgeting? Oh, do you have a mic? There's a mic there. I repeat. Okay.
So how can the government?
How can the government utilize existing tools and develop new tools and mechanisms at the national and county levels to address current implementation gaps in GRB? Let me try and see. As you're thinking, let me try and see if you can put it up on the slide. As you're thinking.
Send me that version. Sorry? Send me
I
this
sent you.
version.
I hope we are thinking. Okay, so how can government utilize the existing tools or develop new tools, either the county or national levels, to address implementation gaps in terms of GRB? Do you need to train people in terms of gender? Do you need to capacity build? Does it need funding? What do you think? Like, for example, what we learned, the GRB tools that we learned today. So, do you think the tools that we learned, is it applicable, or do we need to develop our own homegrown tools so that you're able to address gaps with regards to GRB? Is it easier now? Josiah, and then I'm going.
Thank you very much. Quickly, I have gotten this from Gladys here. When we were doing the exercise, we were trying to analyze the budget. One of the reasons why we couldn't find conclusions because the data was not disaggregated. So even before the tools are developed, the government needs to disaggregate the data, so that now it's like a ground where now the tools can be applied and you can come to some conclusions, rather than stopping at the data is not there, so we cannot comprehensively conclude about the position of what the government is doing in terms of gender responsiveness. And I think this has been echoed across many discussions, that we may not know the exact impact and of government interventions because of lack of that data. So that's one of the things. The other ones now, the other point is on the enforcement. We are lacking enforcement mechanisms. We have policies. The constitution is clear on equity. There are certain gender policies that are in place, national, county level, action plans, but the enforcement bit is lacking. So if this could be a requirement that ministries, departments, agencies are required within their budgeting practices to perform certain things or explain what gender measures they are taking into account to address issues of equity in their departments, then that would now require them to use certain tools so that they can get the data, or they can assess the impact of their programs. Thank you.
Okay. All the sub-programs in both the national government and county government should have gender lenses, and they are being formulated. For example, we have a sub-program in the county in the infrastructure called Public Works. So it's upon them in the sub-program to put that building code whereby they emphasize on the lamps in all the buildings. For commercial buildings, they should set spaces for the crashes. There is a lot of climate change, and it's being experienced almost everywhere in the world, and they should also give spaces for greening, in the urban setup. So most of the sub-programs should have the gender lenses. when they're being formulated.
Thank you, Petronila.
I don't know, but I feel like we've done, Kenya is so famous for capacity building. I feel like Kenya is so famous for capacity building. We've really been doing capacity building. It's even become an issue in our budgets. Like Kenyan workers, government workers are always going for training. And I feel like it's about time we start implementing, because a lot of the things that, a lot of the countries that are leading in gender have actually come to Kenya, copied our laws, word for word. The only thing they'll change is the country name, and then go implement them, and they've become the best. So I feel like it's about time we moved from training to implementation. Securing political goodwill for this, collecting data, as we all agree, data was missing in, like real. So we have the data, like we were looking at the Nairobi program-based budget. We have the data, yes, but is it sufficient for us? Is it sufficient for a practitioner or anybody who wants to use evidence to then pursue that cause? It is not. So we need now to move from the superficial level of training and saying we have the data to actually looking at what data is this and how then can we implement it, how can we become better at it, so that now we move the wheel. We've been on the training space for way too long. As for homegrown solutions, I think I've been part of some, including developing a guideline for counties to be able to do gender responsive budgeting. Is it in use? No. So is there a point of making another one? No. We should start with what we have. We have excellent laws. Actually, we have fantastic laws. And we are famous for having very good laws. So we now need to turn the wheel and move it to implementation. That's what I think.
Thanks, Wangui. Yes, you.
Okay. We are speaking about the ability of reading government budgets.
We'll come to that later. Now we're talking about how can the government use whatever they already have in order to spur GRB, either at the county level or at the national level.
I'll come back.
Okay, or you'll come back. Okay.
For me, is to start the implementation. As Manjuka has rightly put, we've stayed in workshops in hotels for so long. It's time we start the implementation and mainstream the gap, the knowledge into addressing and utilizing these tools to address GRB. Kenya has the best laws, regulation, policies, which other organic countries have actually, as she rightly put. Today we are implementing devolution. Another country is starting devolution possibly a few years from now. They will come and learn how devolution is working in Kenya. Then they will run with it. Then we will go to Rwanda and say we are going to benchmark on devolution. So my point or my take here is it's the right time for government, both national and county government, to start implementation. It's not even to wait. If it's trainings, these people have been trained. And some of them are coming from these sectors where gender mainstreaming has been taking place. So it's actually to put more energy and request for resources. If it's resources, then let them have the get the resources. Then lastly, is actually to have segregated data. This is what we are learning, and the budget gaps that we always see, that segregated data is missing. Sometimes locations are made without targets. Then sometimes locations are made, targets are there, but the indicators are not communicating with the targets or with the location. So this is what needs to be mainstreamed, streamlined, and we are set to go. For workshops, trainings, I think we've had enough.
Yes, Darwin.
I think from all this conversation, it's reminding me one thing. We already had like a foundation, and NGEK went ahead to make actually some GRB guidelines. And 5 years on, right, Wanjiko, since the NGEK guidelines, GRB guidelines were, drafted. So I think our target to achieving GRB in Kenya is just to implement those GRB guidelines by NGEK, because everything I think captured by Wanjiku, by Josiah about data, all is summed up in that guidelines by NGEK. Again, another thing is Kenya's, I think, major obstacle to even achieving GRB is these gender-specific expenditures, which are always interpreted as Kenya being gender responsive in its budgeting. And I think that's it. When it comes to data, recently the county statistics bill was also introduced, and all this disaggregation, breakdown, even in sectors, it has all been captured in that county statistics bill. So as rightfully put by Wanjiku, we have already all it takes in terms of institutionalization, in terms of legislation. It's all in place. Even the framework we need to use to achieve GRB is in place, but it's not being implemented. And I think that's why we really need to work with these women parliamentarians, so that they also make it clear to everyone that gender-specific expenditures are not gender-responsive, expenditures, and the general move can be towards there. And my last statement is, someone asked in the morning from our group, should we go the gender-specific way or the, gender-responsive way? And I feel like we need to be open to the fact that there is a reason why all this index, put Kenya's gender equality at 60%, at 30%, and one even stated it will take us like 100 and something years to close this gap. So that brings me to why we need the gender-specific policies and expenditures. Because women are already disadvantaged, we need this gender-specific policy and expenditures to make sure that we are fast at par with men. And then now we can use the gender-responsive policies to actually now keep up that gap we will have closed. So yes, so again, NGEK, I think the ball is in their court and parliament to ensure that all these are implemented.
But the role of NGEK is mostly oversight. So I think once the document is out there, it's for either the national government or the county to now implement. And then, I think also the Council of Governors has a document on GRB, if I'm not wrong. I think I've seen something of the sort. I'll Google it quickly, but they also have a document on GRB. So it's all a matter of implementation is where we are lacking. So that's what I was asking. If it's in terms of implementation, does it mean at the county level or the national level, people do not have the expertise to implement, yet we've been going through so many workshops. So we should be implementing by now. Yeah. Political will.
Yes, the political economy. I think there is need to also buy in other people, because we confirmed yesterday that if you don't have a voice at the table, you'll be on the menu, right? Yeah. So I think there's also need to look at then how do we buy in more people to look at our, GRB, and the move from making it look like a women's issue to a gender issue. Yeah. And I think Cron did this. There was someone from Cron Trust. Contrast went the other step to actually show what are the opportunities Kenya is missing economically when women are not brought to the table. And I feel like because people relate well to numbers and money, if we keep building that case that our GDP is 6% less than what it should be if women were at par with men, I feel like that way it will look more of a everyone, wins type of situation, other than it's just like we are pulling women up here.
Thank you, Daniel.
No, I wanted to pick on your response on the National Gender and Equality Commission, GEC. They don't like to be called GEC anyway. The issue of oversight role. What is oversight? What is the scope? What does it mean? Because what we're struggling here with is the accountability framework. Who can ask the county governments, the national governments, if they don't do it? If there is no framework for that accountability, and I believed that is the role of National Gender and Equality Commission. Because they gave us the guidelines, so what? So can they look at budgets and implementation and then tell the county and the national government, no, stop. This is not gender responsive. Wanjiku mentioned Uganda in the morning. But I have a better example from Rwanda. They have the GMO, the Gender Monitoring Office, which looks at budgets before they are approved to ensure that they're gender responsive. It is called GMO in Rwanda. So if we had a similar mechanism or structure in Kenya through the National Gender and Equality Commission, then we will not struggle with this question of how gender responsive our budgets are and whether they're implemented. Of course, we don't need new tools.
Yeah.
Unless we are developing to sell to another country, yeah, that can be a good business. We don't need new tools. We just need to use what is there because it has worked elsewhere, and then we make this a reality. And my seatmate here whispered to me that we need to do like evaluations from time to time to establish one of the items captured in our workbook here, the gender impact assessment of a budget, for instance. Yeah, we do like a study to establish how that budget cycle or that budget of that year, how or what is the impact on the gender issues in that particular setup, both men and women, boys and girls. So we have the tools, we have the hardware, as we say. What we need is a hardware. Yeah, the hardware is there, but the hardware is what we need to excel in this.
Thanks, Daniel. When it comes to matters studies, I don't know if counties fund research studies. They don't. Do they?
They don't.
They do or they don't?
They don't have an officer for data. Data officer.
Private organizations, yes. NGOs, yes. But counties, no.
But on that note, then the county needs to consider partnering with organizations that have done research, that they have data, because we have data, but where do you get this data from? So one of the approaches that we are looking in the morning in GRB was the
five-step approach.
Yeah. I was doing, AMREF has a program called Y Act, and I happened to mark those specific component of GRB. So that's where I saw those people who had undergone that program from different counties doing the situational analysis, the policy bit of it. So now we have data that this organization, but then the point of partnership is what could be lucky,
Because, for instance, if we have a policy at the national level, but at the county level, the county is not collaborating with the CSOs to understand what is the situation at the ground, then the county needs to consider partnering with these organizations that advocate for issues of public finance management on specific issues of gender responsive budgeting, so that we have synergies and collaboration to achieve the best results when it comes to implementation process of these policies that we are talking about.
Yes, Monica. Monica, then Prudence, then Purity.
I think having worked in both government and the non-governmental organizations,
On this, the other mic.
Okay, so having experienced or worked in both the government setup and the non-governmental setup, I think there's one thing that has mostly stood out. I was sharing with Josiah yesterday that when it comes to implementation, the reason why it's a problem is because we are always throwing the ball, to one another, to and fro. It's the NGOs that should be implementing, it's the government, I don't know who. So nobody really owns the implementation part. There's a time I was in a technical working group for teenage pregnancies, of which we are currently number 3 globally. We are leading in teenage pregnancies as a country. That is globally. And in this technical working group, we had a lot of discussions. We had, I think, 2 CSOs on board, and then there was the government officers from the county and national. And we had a lot of discussions for 3 days, nice hotels. But after that, there was really no conclusion on who should be implementing. And my thoughts on that was that, well, the government is good at providing the strategies, providing the policies, and coming up with things like that. But when it comes to implementation, I think it's much easier when the organizations are able to get the funding, especially because there's so many projects stalling because the government is not able to fund some of these projects. But then again, I think the blame game is what is standing in the way of implementation. Someone really needs to own up to implementation.
Thank you. Prudence?
So thank you. Mine will mostly come out on the basis of accountability, both at national and county levels, and also as a question to those of us who are working at some of these county offices. So there are these tools that we have, like the county government performance contracting, and which is also translated to the national level, and they do the midterm reviews and the annual reviews and share reports for that. So does the gender responsiveness of these projects that are being implemented actually come out, or is GRB included in the matrices, in the performance contracting matrix, to see that this is actually assessed and we can see whether the programs that are being implemented are gender responsive or not? Because now this translates to the gender impact assessment tool that we are all discussing, and that's the only way that I think we are going to be able to hold the executive at both levels accountable for the programs that are being implemented.
Thank you. Purity, final one.
Yeah, so I think on research, it's working.
Microphone is off.
Sorry.
Oh, it's better. Most of the counties don't have research and policy departments. If any, maybe at the national governments. And that's why we find it's really affecting policies, because the research department could have been advising the county on issues to do with gender mainstreaming. One of the things that the county usually do when you're coming up with a policy is that they link you with the county attorney's office, who now interrogates that draft and advise you. But you see, the gap is the lawyers will now advise from the legal perspective, but not from a research perspective. So, and then number two, again, what we do in my organization, from the research that we have conducted during the launch of the reports, we bring the relevant departments together to come and own up that document from the beginning. So you find that most of the community health issues, they have adopted it. But of course, it's not that they will openly say that they took it from another non-state actor, but now the recommendations is what the country will now pick and implement it.
Just wanted to add to something Asha mentioned about collaboration and working together. So of course, when we talk of data, it's what data is this, who has this data, how can we consolidate whatever data is out there to be able to use that data to make decisions. And so there's something, when we talk of data at the national level, of course, we have to think of KNBS being a data institution, and they do have some really good data, just beyond the census data that they do, but some of it is very outdated. So they, for instance, we had the Kenya Integrated Household Budget Survey, and the data that we quote from that survey is from 2015-16, which things have significantly changed since then. So one of the things they tried to do and invited a couple of CSOs is how to consolidate citizens, so they call it citizens generated data. So there is data that these organizations collect. We have data, you have IPF has data. So you have very many organizations with data that they collected from research work, field work, and all that. But how to bring that together, how to make sure that you are collecting quality data and all that, just beyond what KNBS can collect and what it's mandated. So it's sort of having KNBS as yes, as the body that tries to collate, yes, that's the word, to collate this data that can inform decision making. But also, even beyond that, beyond the data that is directly collected or collated from what is already existing, counties may not have the capacity to go out there and specifically or directly say we are collecting data so that it can inform our gender responsive budgeting or any other budgeting decision for that matter. But they have, they do monitor implementation of their budgets. There's data that is collected during monitoring that is supposed to go into implementation reports and all that. So when they go back to the implementation reports, there's data that is already existing there, but the question as to whether that is something that then informs subsequent budgeting, that's a whole other thing that it's something they're probably not doing. And also it could be they're not monitoring to a very good extent, because so at IBP we conduct county budget transparency surveys, and one of the things that we look at is the level of information in these budget documents. And for implementation reports, they have some of the one of the least comprehensive information compared to other budget documents. So it's to say that this is sort of done as a tick box. We have an implementation report and that's it, and not necessarily to collect data that is not only viewed as reporting data but can inform subsequent budgeting.
Thank you. I think I'd like to move on now to reading budgets. We could refer to the budget that we did in the morning, the 2020-2021, from your devices. believe you had a question. Is it coming here?
No, I just wanted to mention about the same CBTS survey. It was found out that citizen budgets are also one of the least published budget documents. And it's required by law that every county does that, so that the general public can be able to read and understand what the budget for that particular financial year has in store for them. So that is directly linked with the ability to have meaningful public participation, because I'm not going to come and give my views in a public participation forum if I cannot be able to read and understand that particular document. So I think the government, since it's already in the law, they need to enforce that. Because I think apart from Makueni, there are a couple of other counties that are trying to publish those citizen budgets. So there has to be like sort of a reward or consequences if you don't publish those citizens' budget, because it's like a hindrance for the public being able to understand what is in store for them, and therefore they cannot advocate for their priorities and their needs. And if you're being specific, like for example, unpaid care work, if we don't know what is in store, I can't know how it is allocated or catered to in the budget, I cannot be able to write a memo and try to enforce or ask for that to be made available. So citizen budgets are important, and I think also moving forward, we should also push for that in our advocacy so that the greater public can understand what is happening in the budget.
I've seen it online, but I do concur with you. It's something that people are not aware of, and it's not being... It's not like the way you see memorandum of... When Parliament is checking out a memorandum, for example, if they want your views on the budget. So for the citizen budget, so it's published by the counties and it's not out there.
Most counties are just not doing it.
Oh, they don't do it at all.
Okay. It's just not there. So even Makueni has done it even in Kikamba. So
nice.
language. So you see, it widens or narrows the gap of those guests who cannot understand what is in those documents based on language barrier. So we'd like to see counties doing that, going a deeper step and doing budget documents in vernacular languages. No, it's far-fetched, but it is possible.
It is possible.
Yeah.
Yes, you can.
Yeah. Okay, the counties that are very... They only understand vernacular languages. So how will you communicate? People.
Sophia?
So I'm thinking, does it have something to do with public trust?
Publication of the citizen budget.
Or everything around all these things that you're talking about. Because as she was speaking about data, I used to work with KNBS, and apart from that, you've called it KBIT. There's another one called Kenya Continuous Household Survey. But when you go to the households, they are not willing to give you the data. They tell you, you always come, and then you don't help us. So maybe could it be public trust?
Maybe, because maybe they also want to know, what are you going to do with my data? Maybe you come, you collect the data, you go. You come back another 5 years, collect the data, then you go.
I know we are all stalling at, we are failing to implement because we don't have data. So
I can add, there's a big gap. There's a big gap
on civic education and how it is done. Citizens don't understand government processes, and that's why they resist some of those things. But if there was a concerted effort and resources to build a very robust civic engagement led by counties, led by the national government, continuous citizen civic engagement to discuss and to understand government processes and programs, and what the community's engagement and contribution to those processes looks like, whether it's in terms of providing that information, attending public hearings, and other things. We were in Samburu on a program, and we were trying to find the level of civic engagement or education, and they told us that there's no department. The county doesn't conduct. There's no department for civic education, and so we're trying to understand how do then citizens prioritize what is important for them if they don't understand how government processes work. We want a borehole, we want a road, but we don't know the process that leads to getting that road. So there's a gap, and that's why it came out in some counties. They just request for things. Citizens just come sit in a meeting. They say we want a road, and probably the priority at that time might be water or something else. So there's a big gap on civic engagement that we also need to address. I like the point that it can be collaborative, where the government, because as much as the counties take the brunt sometimes, but we also understand that they are also under-resourced due to many other reasons. So also synergizing those partners like IBPK, APFK, there's IEA, there's also another ALCAGS, I don't know, his organization is called something, Open Society. Open Society. Partnered with like 8 counties to generate some data that the counties are using for their CIDPs now. So it's something that can be done. Civil society is partnering with county government. So these models or case studies need to be expanded to include more people. So like we have ALCAGs in those counties telling us how this is working. So other organizations that can support that can also scale up in other counties and replicate the same, so that we address issues of data and other things. Thank you.
I think I'm hearing a lot of synergy, collaborations, and partnerships moving forward. Do we know how to read budgets? There's an expert on this table, Darby. On this table, we have a statistician. Smile. We have Asha, even Purity, and Petronila. In fact, we have so many people. On this table, we have IBP. And Francis. Mkopoa. So you can take us through IBP. Take lead. Okay, you were not here in the morning. In the morning, we went through 2020, 2021, the program-based budget for Nairobi County. No, I'm here to give you moral support. If Francis, you can just comment on and give us highlights on what you're supposed to look at when you're looking at the budget. Just highlights. You don't need to leave here if you don't want to go in front, but you can use the mic. Are we on 2020, 2021 Nairobi County budget? Yeah? Josiah and your group? You're good. Susan and your group? Mko 2020, 2021? So.
So I think I'll just do it in brief, because so at IBP what we've tried to do is summarize this in 20 questions that you should ask or you should consider when you're looking at a program-based budget. Essentially to say that you don't have to get a program-based budget or a budget document and read from page 1 to 160 in the case of Nairobi County's program-based budget. So the 20 questions summarize what we should look at, but I think the basics of it all is to understand revenue and expenditure, because that essentially that is what a budget is you have money and you have what you're going to spend the money on. So revenue, where is this revenue coming from? You have revenue sources that you should look at. We have at the national level, of course, you have ordinary revenue as one of the main revenue sources, but the government also borrows. So we have debt, or we have loans, but it also receives grants from international organizations. You have development partners and other institutions like World Bank, the likes of IMF. So that is the first thing that you should always consider. So you always have a revenue section. So this is what the government is looking to receive for this coming budget year. So that needs to be your starting point when you're looking at a budget document. So for this case, the program-based budget. So there is revenue, but then there's the expenditure side of it, which is a bit wider than revenue. So then it narrows down to what in the expenditure sections are you interested in. So this comes down to sectors or departments or MDAs. So if you're looking at, you're working in the water sector or the health sector, you're looking at roads and all that, then you want to go to the sections that we have. Each department or each MDA has a section in the budget where it outlines its priorities for the coming year. So there will always be a narrative section at the beginning of that section that goes into the expenditure estimates for that particular MDA. So you always also want to read that section because it speaks to priorities, but it also tries to speak to previous performance or previous achievements, where they have been disaggregated into. So you have programs. That is the good thing about program-based budgets, is we no longer have itemized line item budgets. So line item budgets will be just one line that is not disaggregated into anything. You cannot track because there are no indicators, there are no targets and all that, there are no KPIs. So what program-based budgets have done is we have programs. We have the main programs. They could be 4, they can't be more than 4, right? Yeah, there's a limit. I know there's a limit to the number of programs that departments can have. Then under that you'll have sub-programs which are much more disaggregated than the programs. And under sub-programs you'll also have now the specific project or yeah, it is projects. That is the lowest level. So that is a very specific project that you'll have indicators, you'll have targets, you'll have, and you should also have baselines. So based on what was achieved in the previous year, what is being proposed. So those are the two main things that you should look at. But as you go into now the revenue estimates, what is being proposed and what is being proposed in the expenditure side, you don't want to just leave it at that, because you're probably looking to say, for health, we think that the research and development program is under-allocated. What are you basing your argument on? So then it takes us back to looking at previous financial years. So that's always an important thing to keep in mind. So when you're analyzing budgets, you always want to look back at least 3. So we say at least 3 financial years. So you can say you have a trend. You can do some trend analysis to say, when you look at the previous financial years, the budget allocation to, say, the R&D program has been declining. So then you're able to ask why. Why has that budget been declining? So that is looking at allocations. But you're also, because previous financial years have fully been implemented, then there is also the data on actual expenditure. So we proposed to spend 70 million. But we, according to what was actually spent, that is 60 million. So there is underspending in that regard. When you look at 3 financial years or more, maybe to 5, if you want that challenge, and you look at absorption rates, if it's declining, then still you have questions to ask. If the absorption rate is going up, then it means the program, there is more and more that is being spent on the program. So if more and more has been spent on the program, or the absorption rate is going up, and in this particular budget that is being proposed, you see allocations have drastically gone down, then you're able to ask, why are the allocations going down, yet we are seeing this program is spending more and more. But there are exceptions to that, because you'll find that certain projects have to be implemented over a number of years, say 3 years. So if they have to be implemented over a number of years, then you expect that the allocation is going down because money is being spent, but that should also be backed up by non-financial information. So that is the other thing that you always want to look at. So beyond the numbers, what are we seeing on the non-financial side of it? So if a program or a project is being implemented over a couple of years, like some of these flagship projects like the dams and all of that, when you go to the sector reports that is at the national level, that try to provide a bit more comprehensive information regarding when you're trying to find non-financial information, you should be able to see for this dam in the first year, they were able to, the completion rates got to say 20%. So then it got to 60%, so 80%, 90%. So that's to mean if the completion rate is going up like that, the budget should also be declining, because you're spending and you're also, on this other side, it's nearing completion. So you expect the budget to be declining. So there will be those exceptions on where the budget estimates should actually be declining and not going up.
Yeah. Wow.
She did a good job, and I just told on the spot. Thank you so much.
I think
and you didn't have a slide.
You know, and you still followed. Thank you.
I was going to add justifications.
Please do.
I always look for justifications. So that's why I was saying the narrative section is really important, because if they're not justifying why they have allocated this and this, beyond you having to go into previous years and actually finding the justifications yourself, they should be able to justify their allocations. Yeah.
Thank you so much. Do you have any questions, Daniel?
She intimated
Just
20 questions.
Just before the question, just an input. Again, what you also need to consider is the next years are communicating with the narrative part of it, so that the narrative shouldn't be communicating different information than when you go to the next year. The next years are not communicating. Yeah.
And Faith, the 20 questions. Could you share?
Yes, we have, it's actually up on our website. So we have 20 key questions about your county budget. That's for the county, but we have one that should be coming out for the national budget. It's not much different. It's not much different from the county one, because the documents are supposed to mirror each other, but there are differences with regard to, say, loans, grants, and all that. But it's up on the IBP website. So there are 20 questions. Yes?
Is it PDF?
Yes, it
it's
is
something
PDF.
Okay.
Yes.
You can send to Josiah, then Josiah you send to Hannah, then we'll put it in the list of documents that you shall have.
Sure.
Yeah, kindly.
Yes.
Yeah, because we were talking about like reading budget, but I think also there's something else, and I think it was also from IPPK. I actually saw it from John, but he was analyzing it from a point of equity and just a general budget and how the shares have been decreasing or increasing. But it made a lot of sense from a gender perspective, because what was done, he actually took, you see the way you have the 10 sectors. The budget has 10 sectors. So you have national security, energy, health, water, all those things. And then he put years, like 2021, 2022, this is the allocation. Then he did 2022, 2023, 2 years. Then he said, in 2021, the share for national security is 8.4%. In 2022, the following year, the share was 9.8%. If you go to a sector like education, the share of the budget was 26%. In the following year, it was 25%. So if you would read the budget, you would actually think the education budget is actually rising, you see. Because let's say, take for example, if they allocate like, let's say I figure like 25 billion, for example, this year, and last year they had allocated 24 billion, you would think that the education budget, there's an increase of $1 billion. But in actual sense, if you took that 25 billion as the share of the budget, you'd find that it's not a priority in order of ranking. So if you to, like say the government is prioritizing education, it should be very evident in the share of the budget, the education budget. So the growth in the sector share of the budget is important. And in fact, this gives you a very good, like if you're engaging with government, you're able to win that argument. Because from that analysis, 2021 to 2022, the lowest, there was a decrease in agriculture spending as share, education, which we think is a priority of the government, social protection, health, and the sectors that seem to be prioritized were national security, energy and infrastructure, environment, and general and economic affairs. So that, yeah. So, yes, tell me. Yeah, I probably think so, because national security seemed to be doing so well, and was a priority of the government. So yeah, that's my addition. Thank you.
I think the question that Josiah, you're answering with what you're sharing, and it's something that we often ask is what is the government's priority, and what determines what is a priority. It cannot be the absolute figures, because when you look at the education budget, it looks very big because TSC is somewhere there inside. So salaries and all that, a big chunk. When you look at when you look at the IBC budget, for instance, as an MDA in the last 2-3 years, the budget went really high because again elections. But it doesn't. But it does not necessarily mean that it is being prioritized at the county level. The health budget is usually, for most counties, it's 2 billion plus compared to other sectors. But that's because, again, it's heavily devolved. So it's a big part of the county's budget. So that's why then the question of shares comes in. And so essentially it's to say, where does the extra shilling go? So if the budget goes up by, if you had 100 shillings and now you have 105, who gets the extra shilling? So then that person or that department is the priority, whoever gets the extra shilling. So that's why you look at shares there.
Yeah, so thank you. Yes, Daniel.
I've quickly scanned through the 20 questions and just wondering the gender lens in them.
I've not looked at the questions.
I've looked at them. There's no gender lens. Just
open questions.
Yeah.
Stefan, you want to?
Because you moved from 16 questions to 20 questions.
Yeah.
Maybe next time you may think of 21 questions. So that you have a gender lens. I've scanned through.
Yes. No, you're right. There is no gender-specific question per se. So I don't want to say that it's because the questions were formulated a couple of years back, which we are revising. But that does not mean that so mostly it was the questions are with regard to how to read a budget document. So when you're doing analysis, we always do this, we will look at other systemic issues, equity, we look at transparency issues, we look at gender. So there's there are those lenses that have been incorporated, especially in analysis. Yes, but maybe it's also to be very specific in having that as something that people look at. So in the questions. Yeah.
All right. Maybe just on the issue of priority, you said it right that a sector that we look what informs priority. How do you identify a priority in a budget? One, it could be an allocation, but not conclusively. But we look at the one that gains with time. So if we are informed by our past trends that we have the health department gaining in terms of allocation in the budget, then it shows that this department is becoming a priority for the government when it comes to implementations. And also, we say that priorities change over time. In this financial year, our priority could be SGR. In the next financial year, we have something else as a priority. So over time, when we are doing the budget analysis, the priorities will change. But I think what Faith is saying that when you analyze budget documents, you do not just rely on one budget document. Like recently, I was doing the analysis on the Office of the Auditor General reports, and at some point I had to go to the Office of the Controller of Budget reports and look at what the counties had reported as own source of revenue. So that's just to counter check the data and make sure that you have facts and the data is very credible.
I think Lucille had to step out briefly, but do you have any other questions about the budget reading process?
Not a question, but maybe an addition. Something else you might want to consider looking at is the supplementary budgets, seeing how the government adjusts to different things that happen throughout the year. For example, data on budget allocations on COVID-19, you found them in the next supplementary budgets, and then you could also actually see where they reduced their allocations so that they could cater for COVID-19. Another thing is to check whether the narrative that the government is giving us is coherent with what they are doing. For example, they keep telling us they're on a fiscal consolidation path, but when you look at the data, they keep revising the fiscal deficit target upwards. So I think that's not a commitment, it's just a way for helping you to find whether the narrative is actually coherent. Yeah.
So this level of transparency with the supplementary budgets and them indicating where they allocate, where they reduce, and is this all levels? Is it that transparent at the county level?
I think the supplementary budgets are only at the national level. Asha? County as well. Okay. So yeah, I think in both of them, but they just keep revising and showing how they are changing their priorities within the fiscal year. Yeah.
So there's a monitoring role to be played by civil society organizations, specifically here, to be able to, because this information is available, this data is available, so it's a question of monitoring. Okay. Okay. Thank you for clarifying. Okay. Do you want to first?
Thank you so much, Faith, for that session. At least now we have a bit of information in terms of the budget and matters data. And I don't think we have. Yes.
Another thing, when our chairperson convened us, one of the things that it is also good to also be very keen, interact first with your county of interest budgets, especially on health, because health attracts a lot of revenue and a lot of budgetary allocation. And so that when you're reading the national budgets, you can actually compare. Because from the health group that we were in, we discovered there was double allocation of county-based projects. It is the same project also also budgeted for by the national government, and you could see it was coming from a particular office. So it also enables us to also start questioning, why is it that this project has double a budgetary allocation by the national government and the county government?
Thank you so much for your insights. It is now 4:20. Today we agreed we shall try and meet on time. I think there's recap by Hannah and Evian. So welcome, Hannah and Evian. Thank you.
Yeah, thank you everyone for your attention today. Today, of the 3 days, is definitely one of the more content-heavy days. Tomorrow we'll definitely have more of an interactive look at how we can use the knowledge from today in sort of the advocacy and capacity building spaces. And we're definitely tailoring the training as we move along. So today in the workbook you'll see we had a GRB checklist exercise which we swapped for the unpaid care work exercise that we did today, because we saw, you know, the exercise in the workbook is more of an introductory level, and a lot of the conversations we've had over the 2 days have touched upon unpaid care work. So we thought that was, you know, a great way to kind of consolidate all the learnings that you've had and give you the chance of putting your own policy forward. So we hope that you enjoyed that exercise today. So as a recap, so these are some of the points that we've looked at today. We can say that every gender responsive budgeting initiative has to choose tools that are most appropriate. We touched on a couple today. There's still lots more available, and they are all adaptable to the objectives of the initiative. We've also looked at gender data collection as an essential tool to understanding the different interests and needs and priorities of existing inequalities between men and women. Employment, unpaid work, mobility, decision making, and gender norms are all inequalities that we should take into account, and initiatives should aim to increase citizen participation in the budgeting process through demystification. Yeah.
Thank you, Evian. Yep, so now that we've recapped all of the topics that we've gone over today, we're just going to give you some 5 minutes of reflection, personal reflection. If you'd like to turn to page 23 in your workbooks. There are a few questions that we've posed to you to help you frame and close out the day in your mind. The first question, why did I succeed? Okay, so first you need to identify a positive situation where you felt successful during today throughout the workshop. Once you've identified this positive situation to reflect on, ask yourself the following questions, and you can note down any answers in your workbook. The first question is, why did I succeed? So thinking about this positive situation, why did you do well in it today? Why did I succeed this time compared to other times? Question 3, what will I do differently next time? And question 4, what do I need for that to happen? And then of course we've got our favourite mood check at the end, if you'd like to circle one of the emojis that you feel most reflect how you're feeling at the end of the day today. Yeah, so 5 minutes, and then we'll do a quick feedback, and then everyone is free to go and have their evenings.